The first action item on the agenda is the approval of the minutes of the April 24, 2012 Committee on Agency Operations meeting. Please review the minutes and see if you have any comments or any corrections.
Move to approve.
Any further discussion? No. Otherwise, all in favor say aye.
Aye.
Anybody opposes say nay. Motion carries. Thank you. And we are going to take the next agenda item out of sequence because our commissioner has to go somewhere at 3:30. And this is legislative appropriations request agenda item. And item number 5A is consideration of adopting commissioner's recommendation to the committee regarding the coordinating board's legislative appropriations request for the 2014-2015 biennium. Does any member have any objection for this consideration of taking it out of sequence? If not, we will proceed with the agenda item 5A. Dr. Lanzo, Dr. David Gardner, and Linda Battles will present the item. Dr. Lanzo, please.
Thank you. We will call on Linda to introduce the agenda and the efforts here, and then we'll David and I will come in at our assigned places. Thank you.
Good afternoon, members. It's good to see you. We're going to start off by describing or reminding you what the LAR instructions were to all state agencies and institutions of higher education for the 2014-2015 biennium. The instructions required us to come in with a baseline request for general revenue and general revenue dedicated that could not exceed the sum of the expended amounts of FY12 and the estimated budgeted amounts in FY13. The instructions also left the possibility of a 10% reduction for the FY13 year. So we just want to remind you that that's still a possibility. And we are also required to submit a supplemental schedule for a 10% reduction in 14 and 15 in two 5% increments. We had some explicit guiding principles from the commissioner in approaching our legislative appropriations request, and he included several guiding principles. One, he wanted to make sure that we did not make across-the-board cuts in considering the reductions. He wanted us to ensure that we evaluated each of our programs based on the merit of their programs, of their success, and also wanted us to preserve as much as possible the student financial aid programs that serve the neediest students, as well as any programs that contribute to closing the gaps and the accelerated plan for closing the gaps. In addition, the staff adhered to the board's focus on graduate medical education, as House Bill 2908 report had indicated the shortages. So just to give you an idea of how we approached this at the staff level, the recommendations began with the programmatic staff, the people who work with these programs day in and day out. So they put forward recommendations that they thought were the best recommendations based on the commissioner's guiding principles and the board's focus on graduate medical education. Those recommendations were then approved by the assistant commissioners and then moved to the two deputy commissioners and myself. And then we made either some modifications or suggestions and then made those recommendations to the commissioner. We had spent last week and part of this week meeting with key legislative offices as well as the governor's office and LVB staff, briefing them on our draft LAR and getting some additional feedback from them. So that is why you will see some changes that we submitted to you last night. And trying to remember when that was. Arturo and David will be going over those changes for their respective programs. Just want to call to your attention two changes, significant changes that we made to our bill pattern compared to our current bill pattern as a result of the sunset staff recommendations. We reorganized Goal A so that our administrative strategies were more directly connected to the functions of the agency. Our previous bill pattern was less transparent and was more directly tied to the goals of closing the gaps. So you'll see more transparency, more direct direction to where the dollars are actually going in terms of our functions. As well as the financial aid strategy, we made that more transparent. Before, we had one strategy for our 5 major state financial aid programs into one line item, and we broke that out so that each of the programs had their own strategy, again, bringing about more transparency. So I'm going to turn it over to Arturo now, who's going to briefly walk you through this document, which is the spreadsheet with the highlights.
Just a moment. I forgot to mention that Carol McDonald, she's here from ICUT, and she is a resource witness. If there are some comments, she may participate. Thank you. Carol, thank you.
Thank you, Mr.
And just to make clear, Carol, yes, if you have any questions, Carol is here regarding the tuition equalization grant program.
Thank you, Mr. Chairman. Thank you, Linda. What I want to do is just spend a couple of minutes and go over this spreadsheet that is really the summary. Well, it's a 5-page summary, but we're going to spend most of our time on the first sheet. And it is the one that has the highlights, because that is the one that we sent, actually was not before last, Linda, to the board. And so they've had it for a whole 2 days to look at. But I think that when we did send those changes to you, and by the way, those changes are as a result of the feedback and the questions and the further instructions that we receive as a result of our visits with our stakeholders downtown. When we sent those changes to you, we also included a 1-page explanation of what the changes were from the previous version. So hopefully you have looked at that and those questions have been answered. If not, I'll be glad to go over that. But I would like to just take this spreadsheet then and quickly walk you through that. The first spreadsheet is, as Linda said, we take the 12-13 base budget, the current appropriation or the current biennium appropriation, and we do what we have been calling here at the agency a crosswalk to get to our recommended bill pattern that we will request to the legislature pending your approval and, of course, your changes, if there are any, which we are titling revised base, which is the column on the right-hand side. The instructions were that we had to keep GR and GR dedicated at the same level. And so to that end, this document that I'm walking through now, or that I'm referring to now, only covers general revenue and general revenue dedicated funds. We also provided a more detailed document that has several pages that does include a description of the strategies, our exceptional item request, along with the reductions by strategy. And that one also breaks out the method of finance by all funds. So for purposes of establishing the base budget, we're only talking about general revenue and general revenue funds on this summary document. So we thought that the best way to do this would be to take our base budget and get the recommendations from the staff, as Linda mentioned, this floated up, where if you wanted to craft the request for what you want the appropriation bill to look like for 14-15, where would you shift funds amongst or between strategies? And the resultant the results are what you see there in the outs and in. Up through yesterday or day before yesterday, when we sent you the revised spreadsheets, those outs and ins were balanced. In other words, they zero each other out. The total amount of out the total amount of in. Well, that's no longer the case. And the reason for that, and David will get into some of the programs later, but the reason for that is that we received instructions Thursday morning during one of our visits with the LBB downtown that they wanted to take Baylor College of Medicine out of the formula, out of the bill pattern. Not that if Baylor College of Medicine is listening, don't panic. Not that they are defunding them, but they want to treat them the same way and handle them the same way that they are treating all the other health-related institutions, which is outside of their LAR. It's going to be handled through the formula process whenever those recommendations are made. Now, in the final analysis, because Baylor cannot receive funds directly from the legislature, that whatever they end up with will end up in our bill pattern. But for right now, so that's why you see $155 million coming out and only $69 million going in. So it is out of balance now, and that's because the outs is approximately $86 million more than the ins due to that change for Baylor College of Medicine. And so our revised base then, like I said previously, it equaled the $1.14 billion. Now it's with the $1.14 billion less that $86 million. We have a line or a column, row, I don't know what it is, going up and down the middle of the page, which has numbers from 1 through 17. Those numbers are actually footnotes that are outlined on the second page of your document, but that's what we are going to quickly take you through. But those footnotes are there for you to, well, you have probably already read them, and for you to go back and read them at your own pleasure and your own leisure. So why don't we start, David, by having you go through the programmatic changes of how we did the crosswalk, then I'll come back and conclude with the financial aid strategies.
Okay, thank you. And again, these are staff recommendations to the board. So the first thing I'd like to call attention to is that last session the legislature cut all our funds for college readiness grants. So if you look to 8.11, the dollars that you see in that column, a little over $4 million, are really for the administration of the existing grants. So the administration of the existing grants. So as we began to review our budget, we looked at those dollars and believed that we could take a little over $700,000 out of the administration of those programs, that we needed actually fewer, and are making some recommendations in terms of the redistribution of those funds to areas in the agency that are short at this point. So as you look at that, $300,000 of those dollars we're recommending go to three other areas. $150,000 to planning, information, and evaluation for 2 FTE. This is an area, that does all our data analysis, and we're really been very tight in terms of having enough staff to do the analysis we do. We talked earlier today about doing a great deal more work in terms of workforce analysis. These 2 FTE will help keep up with what we're already doing, but also expand our analysis in terms of workforce. $75,000 for 1 FTE to the Workforce Academic Affairs and Research Division, and that will be largely associated with the workforce as well. And then the final $75,000 to Central Administration for 1 FTE, which Arturo will tell you about later. The remaining little bit more than $400,000 in Strategy 8.11 is due to the restructuring of Goal A that Linda described earlier. The same thing is for strategies 8.21 and 8.31. These funds are a result of restructuring Goal A. If you go down the page to D.11, Family Practice Residency Program, we increased the base amount by $4 million, making the total biennial request for $9.6 million. As Linda mentioned earlier, we have emphasized the importance of graduate medical education. We know that the medical schools are expanding, and we need additional dollars for residencies and that type of program. So with that goal in mind, we're trying to improve the distribution of family practice physicians throughout the state and provide increased medical care to patients in all the underserved areas. You probably know from our previous discussions that family practice physicians who complete their residency training in Texas have a 70% retention rate in the state. So between needing to keep those we graduate in Texas longer and wanting to expand to meet the needs of the growing enrollments at medical schools, we're suggesting moving these dollars there.
Yes, Mr. Chairman, can I have a question, David?
Sure.
You mentioned we want underserved areas. How do we know that these underserved areas are going to be served?
I don't know. Stacy might be in a better position to answer that. I told her that she might have to come up.
Good afternoon. Thanks, David. The family practice residency programs are located all over the state. And when those residency programs are located from Texarkana to El Paso, from Wichita Falls to we've got some down in Harlingen. Actually, McAllen, I think, is the furthest point south. We know that those residency programs are more likely to keep their physicians in that local community, so they'll actually put their practices there.
Yeah.
Thank you.
Yeah, that's important for it, is the rural rotations that are in place.
Absolutely.
Thank you.
Well, just to that point, if I could ask, so are you going to have more locations or more at the locations that you have?
Well, the goal is to actually make sure that we continue to have about 700 residents.
Right.
So the funding last time was cut from it was cut 75% down to $5 million for this biennium. So the per resident funding went from $14,000 to about $4,000. And what we want to do is make sure that we maintain the 700 residents that are in our programs and make sure there's space and an ability to support that function and that program as it continues. The goal ultimately would be to expand out the numbers of those residency programs, certainly increasing them.
Chairman, let me try asking a similar question a little bit differently. Does this increased general revenue funding, along with the special item, which would be another $10 million on top of this, does that dovetail with the recommendation from our GME report, our policy recommendation to the legislature, to fund the increased number, beginning with 220 new residencies, added residencies, at I think 15,000 apiece in the coming biennium?
Absolutely. It's not just family practice residents
Right.
that we need. There are 15 medical specialties that have first-year entering positions, and the other 14 and the 15 would be family medicine. They all need to expand their residency programs as well. And
Are we asking for enough money, along with the special item, to accomplish what we recommended in terms of hitting the 1.1?
We certainly went for a reasonable number and one that we hoped would be acceptable and could get funded.
Yeah, if I recall correctly, if we do what we're recommending here in terms of a shift of dollars, as well as receive our exceptional item funding, that we will pay for 10% of the cost of the programs, which is an improvement.
Well, that's what the 15,000 was based on, 10%.
Correct.
The cost of residency lower in the underserved area as compared to the major cities, big cities, cosmopolitan cities like McAllen and El Paso. The cost is lower, or no, it's same?
I'm not sure I understand the question. Are they...
Cost of residency cost, is it same for the underserved area, or no, it's same?
It would depend on how you wanted to parse that out, because there's some economies of scales that the bigger metropolitan areas probably have that the rural areas don't have. So it could be more costly in some rural and remote areas to deliver care than some metropolitan areas. There are no great way to quickly assess that. So,
Janet?
Yes. You mentioned the 75% cut last biennium.
Yes.
This doesn't even restore it.
no,
Does
it's
it?
not.
What would it take to restore us back to where we were then 4 years ago?
I need to look at my little cheat sheet. Does anybody have a board agenda for tomorrow?
Well, I assume if we had five,
Right.
yeah, it must have been $15 million cut.
Right.
Not. No.
It was 20 million and we got a 5.6.
Well, and then there's a special item, which would be another 10. So it's almost, it's $1 million shy of what was cut last time, if my math's right,
Yes,
Yeah.
we've got it in,
if we get both.
so it was 20 million, it went down to 5.6 million. 72% reduction.
So you didn't feel like we should restore it back to that level at all? Or you just feel like you couldn't find the dollars?
We
Both.
felt like we should ask for a reasonable amount of funding.
Okay.
I think it will be if these both are accepted, am I correct? We're asking for 10,353 plus 4 million.
And they cut,
So that would be almost 14.3.
they cut 14.4, I
And
guess.
so 5.6 million is already there. So it will take us pretty much close to 20 million.
Well,
But it still begs the question from before, if this just gets us almost whole with where this strategy was last time, is there another line item strategy that includes,
So there's the one 11 million strategy, which is the new money.
okay. all right.
That's the brand
That's a
new
separate-
money.
All right, thank you.
Yeah.
And if I could just make a quick, go ahead.
Pardon me, does that 11 million shows in here or?
It's in your exceptional
in the
item list in
exceptional
this
item.
document.
So what I started out talking about was actually from our existing base and how we were going to shift money from some items to another in the existing base. Then we added in the notion of the exceptional item we're requesting to ask for money on top of our base to pay for this.
Yeah, there's a strategy D14 for graduate medical education in the detailed booklet, which shows both the base, the LAR funding request, and the exceptional items.
It's actually a separate program. That's a brand-new program that would be established to fund those first-year, I'm sorry?
It wouldn't necessarily be family practice.
Correct.
This is just family practice I'm talking about.
Yes.
Bringing it back to the levels it was 4 years ago.
Yeah, the exceptional item is for the graduate medical education
Right.
expansion effort. So
So that could be
it's a much broader.
surgeons, neurosurgeons,
Exactly.
pediatrics, all sorts of, but I was just talking about family practice. And that really is the goal, is to cover Texas equally with family practice.
That's correct.
And just so that you know that when you start to consider your legislative agenda, this will be the new program will be a part of that package that you'll be considering in October. So you'll get to see the exact proposal that we want to push through in a bill next session. So the other point I just wanted to quickly make is that when we shifted funds around within the base, we tried to stay within the goal so that we're not using, say, financial aid dollars for health programs. We tried to keep the health program money in the same goal. So that's why you'll see that out and ins, those dollars stay within the goal.
So you'll see in the next two items that the dollars that we put into family practice residency programs came out of two other health-related programs. You may have some questions about that.
We have done a lot of cost efficiency studies. Can we lower cost of a residency program from 15,000 to 13,500 or 13,000 or something? Have we looked at that so that we can increase the number of residents and lower the cost from 15,000 per resident to 13,000? Commissioner, have you looked into this? Because I know there have been a lot of cost efficiency studies.
We have looked at, just because the funding decrease was so significant to the family practice program last time, where it was funded at, that 14,000 level, and now it's about 4,000. So we were looking to see whether or not there's going to be a decrease in the number of residents supported. And from our preliminary look, we see that the programs are doing their best effort to remain at their current levels. We're not seeing a lot of growth, so it's not going to keep pace with growth, but we haven't seen residency programs shut their doors, and that was a big concern. So when you cut a budget for a residency program that significantly, you may well see a clinic have to, the program have to close, but they may be able to fund their program in some different ways. Usually that's by patient care services. Now, there is a balance that you want to seek with the residency program between education and service. So we don't know about what level, what shift will happen as a result of that.
And that would be my question. So when you go from 15 down to 4, that's a huge change. And so they made the gap up. If the costs didn't really change, they made the gap. Could you just tell me a little bit more about how they made up that gap? You said through patient services?
Yes, absolutely.
It had to be a big change in the model.
Well, they're providing patient care services either for a community or for a hospital or a service. Each of the family medicine residency programs has to have its own freestanding clinic with someone who makes appointments and schedules patients throughout the day. So they may have increased that load. Now they have to be able to do that within their accreditation parameters without stepping over or breaking any of those rules, or they would be dinged by their accreditor. So I'm sure they increased their patient load. And they probably took out reserve funds, a lot of reserve funds that they had stashed away.
We have to remember that what $11,000, $10,000, $15,000, that's just the state
Right.
spending. The actual cost of the residency is estimated at $150,000. So Durga's question is a good segue to point out that A&M Health Science Center just won some recognition because, and there are some reasons for these differences, but they're apparently delivering the cost of graduate medical education at closer to $100,000. So that's a pretty big delta. So I think there is potential for what you're asking about.
Can we look into it further? Maybe we can reduce, have them reduce the cost some more.
We can take a look at, work with the institutions and take a look at ways to reduce costs, sure.
I think part of the reason is because A&M Health Science Center does focus on family practice, so there's some built-in cost differentials depending on the type of residency as well.
And I think we have to acknowledge that this is the type of thing that is really a national issue, and it's very difficult for one state alone to make dramatic changes without having an impact by what's happening in the other 49 states. I think one could make Texas less attractive if one does something radically different.
I just want to make one more point again. This is, again, a draft, a staff recommendation. It's your prerogative if you want to change some of these amounts. If you do, you will obviously have to take the money from somewhere else, shift the funds, or you can request a higher dollar amount in the exceptional item. So it's completely up to the board and however you want to place your emphasis.
Yeah,
In our
that's
last
exactly
board
right.
meeting, we talked about having some kind of standards for the medical colleges for the space efficiency utilization. And I remember that we don't have any guidelines for the health institutions, nursing schools and medical schools. Maybe some savings will come from there also if we start coming up with some kind of standards for them. There may be substantial savings from their space utilization and other standards.
Yeah, we can look at that. Okay, well, let's stay a minute. we're moving into two areas that Stacy knows a lot about as well, in case you have the same level of questions. D.1.5, the Joint Admissions Medical Program, is one of the areas in which we took money to put into family practice residency. We took $3 million from JAMP and put it into family practice residency. We acknowledge that JAMP is really a very good program. It's provided opportunities for many students to enroll in prep programs and institutions which have not traditionally sent students to medical schools. However, it has not yielded significant increases for the size of the investment. JAMP received significant increases in funding in the past 4 years, and the amount of funding remaining after the reduction is closer to what the program administrators had budgeted in the fiscal year 2008-2009 biennium. The $4 million in the base will maintain the program at a reduced level. We just believe that putting the dollars into family practice residency was more critical to the board and state policy needs at this time. Okay, if we move to D.1.11, Consortium of Alzheimer's Disease Center, we took $1 million from this fund, again, to put into the family practice residency program. This consortium, the money goes to a resource consortium called the Consortium of Alzheimer's Disease Center to the family practice residency program. It includes Baylor College of Medicine, Texas Tech Health Sciences Center, University of North Texas Health Science Center at Fort Worth, the UT Health Science Center in San Antonio, and UT Southwestern. The fund supports collaborative research among these institutions to improve early diagnosis, treatment, and prevention of Alzheimer's disease. Staff believe in a time of limited resources that we really needed to place a higher priority on funding residents rather than on funding medical research at this point in time.
I have a question. I really didn't know this group existed, and I live right up there by UT Southwestern and have been actually an employee there before, didn't know it existed. Have they ever given you a report? What kind of research they're doing? What are their, I just wonder, I guess they're very in tune with you guys, but this group, I doubt, had any knowledge of this.
We really serve as a pass-through agency, so we send the money on, I believe it's over to the Department of State Health Services that actually runs the program.
Okay, so they would get the report.
But we can certainly give you links to get information to you, absolutely, about what it is they do and what their efforts are.
And are they really collaborating, or they're working in silos all over, or what?
I'm sure through these different research grants they are collaborating. The schools have gotten very much better about doing that, and they continue to evolve. They just have to.
That'd be great if you could send us something.
Absolutely.
Thank you. Okay. So moving on to F.12 and F.1.9. If we can start with F.12, these are centers for teacher education. This includes 5 private, historically black colleges and universities: Jarvis Christian, Paul Quinn, Texas College, Houston-Tillotson, and Wiley College. Among these centers, the production of certified teachers is quite low. The cost per graduate is high. The program is really intended to help increase the number of graduates from these institutions. And 4 of the 5 centers are experiencing accreditation problems. This is with the State Board of Educators certification, not the regional accrediting bodies. Due to low passage rates by graduates by ethnic group. And so we're recommending actually at this time that the base funding be reduced by 50%. And we focus the remaining dollars on 2 primary areas. 1, scholarships for recruitment and stipends for educator certification exams. There is some information that suggests that there's students from these institutions that actually, because of lack of resources, aren't even paying to take the certification exam. So this would help provide the $120 to do that, but also to support students while they continue their education. And 2, to really redesign the curriculum so that the centers currently on SBAC accreditation, on an SBAC accreditation plan, or they're actually unaccredited, may have the opportunity to regain full accreditation, so to really essentially help get them back in the pipeline of producing teachers. And with the remaining half, we're recommending that those dollars be shifted to F.1.9, which is the college readiness grant area, for the specific purpose of providing professional development of teachers in high schools with low college going rates in Dallas and Houston. So the idea is those money would be put into the regional service center in those two cities. Teachers from low-performing high schools would be brought in and bring their knowledge levels up to the current college and career readiness standards. So to focus on that effort. So the dollars would be a related effort, but they would go more directly to increasing the quality of instruction in the low-producing schools or low-performing schools.
Mr. Chairman, do we know on the item F 1.2, do we know how many teachers have been produced in that program?
We do.
It's under the notes in here. It says these 5 institutions produced only 289 initially certified teachers over the last 5 years versus an expectation of 300 to 350 annually. So, in other words, they're producing slightly less than 20% of expectation.
Thank you. That's exactly correct. And we've looked very closely at this. The Commissioner really not only asked but demanded that we really carefully analyze this before we make this recommendation. And we think this is a good recommendation. We think we can support some continued efforts by the institutions, but we make sure the dollars are more focused, and then we take the remaining dollars and use them in a very targeted kind of way.
Okay. Thank you.
Okay. I did pass over, by the way, Baylor College of Medicine because Arturo had already mentioned why it wasn't in the item. F.1.6, the African American Museum. This is a strategy to provide 10 internships and scholarships for students who wish to explore a career in working in museums. Museology, I don't know, I can't pronounce that. So what we currently do is we enter into an agreement with UT Dallas and the Texas Historical Commission to develop and implement this program, this internship program at the African American Museum. We've come to understand that UT Dallas is going to request these dollars directly in their legislative appropriations requests so that they can really administer this program directly. So what we're doing at this point, in order to reconcile our total 14-15 base, we moved $133,432 to strategy, our strategy for central administration, but we're going to make clear to appropriators that we fully intend for those funds to be removed from our central administration should the dollars be appropriated to UT Dallas. So it's there really to maintain the ability to do this if that doesn't happen, but we're going to make clear that we don't expect to keep that money if the dollars are in fact in the UT Dallas LAR. So if there are no further questions, I can turn this over to Arturo for the remaining items.
Thank you, David. Let me go quickly over the changes on the financial aid strategies, starting with B11, which is Texas Grant. You see that we're recommending that we put an additional $21 million into Texas grants. Texas Grants is our first priority, has been for some time. I think it's the board's first priority. It's a program that funds needy students, and so the $21 million will get it up almost, well, not almost, but from last biennium to the current biennium, we took a cut of 10% in Texas Grants. We were at $614 million last biennium. This will get us up to $581 million approximately, so almost there. But you will see also that we have a exceptional item to ramp it up even further, and we'll come back to that exceptional item.
What was the amount? The previous biennium again?
614.
614.
Yes. The money and half of that money that we're putting into Texas Grant and TEOG is coming from Be On Time. Be on time, and this recommendation really goes hand in hand and is really contingent on some of our financial aid reforms and restructuring that we will be putting forth and that you will be hearing in more detail tomorrow from Mr. Weaver, or today if you want to, but there is a presentation on this tomorrow where we'll be rolling out some of those in more detail. But one of the things that, if you recall from the Sunset Commission or Sunset Report, and was included also in our management response to the Sunset, is that we would take a look at restructuring Be On Time. This is not an indication, or certainly not an indictment of Be On Time. It is a good concept. It is a good program. It is just the way it is structured, and due to several other reasons, it is not working as intended. So we feel that to redirect those funds into other programs makes sense at this time, and so therefore our recommendation. While we are leaving in Be On Time there, we'll cover the renewal students for the next 2 years in the public colleges and universities. And even in the independent colleges, but renewal students for 2 years. The rest of that money that we are asking to be redistributed is to the Texas Educational Opportunity Grant Program. That's the financial aid program for community colleges, and approximately 6.7 million of that represents the allocation of Be On Time funds that have previously gone to community college students, and we had made a commitment that if we restructure Be On Time, that we would leave a similar amount in there for the community colleges. The rest of it comes from TEOG, Texas Educational Opportunity Grants, is the money that. One of the recommendations, again, you'll hear more from Dan tomorrow, is that Texas Grant, as it becomes a 4-year program, a university program, we want to leave the community colleges whole. In other words, we don't want to cut them and so that represents, it's about $35 million approximately, represents the rest of the money staying in that strategy. Now, whether we come forth with recommendations of TEOG continues in its present format, or we have recommendations for restructuring that particular financial aid program, that's still being developed. We're still in the process of coming up with ideas, but the bottom line is that the community colleges students or the community colleges are held whole and not penalized. The rest of the money that's coming out of financial aid is coming out of the top 10% scholarship, B116. You recall that Linda mentioned that one of the charges from the commissioners to staff was look at the programs that, and try to preserve programs that most contribute to closing the gaps. While this is a good program, we feel that it does very little to close the gaps. This is a scholarship program for top 10% graduates, from high school graduates. It gives $2,000. When it was passed, one of the objectives of this program was to try to keep our top students in Texas. We don't feel, and I'm sure that there's evidence to suggest, I don't know if we have the evidence handy, but that $2,000 would keep a student in Texas, especially when they get an offer of a full ride to somewhere else out of state. So what we left in there is enough money to cover the renewal students, for those students that are already in the top 10% program, and to cover them for the next 2 years. While you don't see, it highlighted, I need to also bring to your attention that in our initial recommendations to you, the July 11th submittal of this draft, of this document to you, included removing $2.9 million from the Texas Armed Services Scholarship Program. That's the next strategy, which is B116. This is a program that is very undersubscribed. There has not been much interest in it. Granted, it's only 3 years old, but there's a lot of money that is really not being used there. And so in our initial recommendation we had made to you was that we leave enough money only for renewal students on there. But we have received a request that we leave it in there, but that we at the same time work towards adding two components to that program. One is that we add a need component to it, again, in keeping with the Commissioner's recommendation that we serve the needy students. And number two, that we get a rider language or rider authority to use any unexpended funds from that scholarship program to transfer to Texas Grants. Right now, we have authority to transfer up to 20% of any strategy to anywhere, but we will work towards a rider that will allow us to transfer any amount of unexpended funds, even if it exceeds the 20%. Yes, ma'am.
How much was unexpended? 50%?
More than that.
Oh, really?
More than that. We had the first year, out of 185 nominations, possible nominations, I believe we had 110, and I'm talking rough numbers, we have that somewhere. The second year it dropped down to about 100. This is just the nominations. Out of those 110 and 100 respectively, the actual scholarships were about half of those. So, like I said, very, very severely undersubscribed.
So what, you have to be nominated to get?
You have to be nominated. Each legislative member gets one nomination. The governor gets two, and I believe that the lieutenant governor also gets two. So for the current year, while we still have about 6 months left in the nomination process, is trending the same way. We have 50 so far, and we still have about 6 months left. But at that rate, we'll get, well, I shouldn't say what we'll get, but if the projections hold true, it will get less than the 185.
The scholarship requires a commitment for 4 years service in the military, which is why one of the reasons why the subscription or the level as a percentage of the number of applications or nominations is lower. I think it was closer to 70 who actually, I don't know if that was year one or year two, accepted scholarships. I don't know what the renewal. 76
in FY12.
So that is a little less than half of the total available, 185. But I think the fail-safe here is that if we can get a rider that allows us to transfer the unused funds into Texas Grants, then the money won't go to waste.
And to that point, and I guess that's where I was confused as to which end of it that the scholarship went. And so this is to give incentive for young people to make a 4-year commitment into the armed services, and so that's when the scholarship.
To be in an ROTC program and a 4-year commitment after graduation.
Okay.
But it includes the Coast Guard and the National Guard, so I think that the proponents of this scholarship feel they can take one more biennial stab at better promotion. And
that would be my question. Do you think one of the reasons that it doesn't subscribe in total is because it hasn't been, quote, marketed properly, or that they haven't gotten the message out appropriately in the, I guess, the previous 3 years?
I don't know if we've done any survey. It's anecdotal. The program was initially championed by a former member of this board, Neil Adams, who was vice chair of this board, and then and also by the governor, the governor's office, and others, as you might imagine, institutions with ROTC programs like it.
And I can say, Bobby, also that after the first year, we sent out reminders, we sent out emails, we extended the deadline 3 times, and so one of the things that I may mention for this is that if a student takes the ROTC, the Armed Services Scholarship, and does not meet their commitment, i.e. enter into the service, it becomes a loan, so they have to repay it back. So I'm sure there's a lot of a hesitancy on that part also.
And in that sense, it's not unlike the Be On Time, which it becomes a forgivable 0% loan, but students, one of the reasons it's been undersubscribed is students worry, well, if I don't get out in 4 years with a B average, then I owe the money back. So it's kind of the same risk-reward analysis, so to speak. Linda, were you going to add something?
No, Arturo did that for me.
All right.
Yeah, Arturo, you and I spoke about that program last week. What exactly is different? What have you recommended changing since we spoke? You said there was going to be some flexibility.
Right.
The funding would depend on a rider that would allow us to have the flexibility if unused funds were available.
That's right.
So that's what's different.
That's different because right now we only have up to 20% authority.
As well as introducing the need component.
And I guess my question is are there not enough ROTC scholarships currently available? I mean, maybe there's somebody's thought that there's a need, but there's a reality here, and I'm not certain that we really need that many additional scholarships with the ROTC currently available.
We've considered that as a possibility for the limited success of the program. Young people, their families know that the military is downsizing, and so there may not be the same need for officers that there might have been 10 years ago, but we will have to do an analysis of what's going on with this program, probably talk to some members of the legislature who haven't nominated anybody, try to find out what's going on. We've been committed to this program and to the concept of this program, but it just hasn't caught on. It may be that it's still new.
And to your point, I wonder, is it the legislature, is it the individuals who are not seeking, or is it up to parents and students to be aware of it, to make a request? I mean, I don't know who we've been trying to talk to say,
Right.
hey, we have this program, because I agree with you. Conceptually, I think it's a worthwhile program, but obviously if it's not meeting the limits, then
And I don't think it's necessarily our agency's responsibility to promote it. Really what we need to do is encourage the institutions that have ROTC programs to promote it to their students and parent community, and then also encourage the legislators themselves to be more aware of it. And the institutions can play a role with the legislators being more aware of it.
The only other item that I have not covered is the rest of that $208,000 that is an into central administration. David already spoke of the $133,000 that we are parking there. That's my term, from the African American Museum. The other $75,000 comes from a reallocation of the administrative funds in the college readiness and success strategy. If you recall, one of the Sunset Commission's report recommendations was that we shore up, or that we initiate a compliance and monitoring section to oversee the large amount of financial aid and formula funds and funds that come in that we handle here at the agency. And so we identified $75,000 out of that excess college readiness and success money, and we put it there to go towards that effort. You will also, this afternoon, you will hear a report from Mark, our internal director of internal audit, on his recommendation to meet that, or to address that recommendation from Sunset. And you will also see that we have an exceptional item that asks for that money also later on when we get to that. So that, in essence, is how we got to our request, or our recommended request for your consideration. But as Linda and both David have mentioned, this exercise was not taken lightly, and it was not. I mean, if we had, I joked the other day to the commissioner that I would have finished the LAR 2 months ago, and I would have been on vacation for the last 8 weeks, but that was not to happen. It is seriously. It is our best effort. It is a thoughtful process. It represents what we think makes the best sense for higher education, for students, for the state of Texas, and so this is our recommendation. If there's no other questions on this summary here, I'd like to quickly go to the next two. Yes, ma'am.
We'll have to defend it in front of the Finance Committee, right?
And the House Appropriation Committee. But ultimately, they're the ones. They're the appropriators, and so the board will submit. This board here will submit a recommendation.
And we'll have to defend it to individual members of the legislature whose interests are reflected in some of these projects.
The second page is, I'm not going to go over that because I think that what both David and I just went through is really those footnotes that correspond to those numbers on the first page. But if you have any questions, certainly we'll be glad to answer them. But it's just the explanation so that you could cross-reference that. The third page on this document, as Linda mentioned, we were asked to identify 2 5% cuts, possible cuts to the 1415 base, or the 1415 GRD base. So what we took then on the third page is the extreme right-hand column from the first page, our recommended revised base, and then we applied 5% cuts, or cuts that would equal 5% of that $1.054 billion. And we divided it between 14 and 15. The total amount there is $52 million. Again, realizing or keeping in mind that this does not include Baylor College of Medicine in the base. So you can see, again, to emphasize the point that I made earlier, that this was a thoughtful process, that the cuts are not across the board. They are, as we feel, we got to take the money from somewhere if it comes to that. So this is our best recommendation. The other thing that we did on this here is that we were asked to rank them in inverse order. In other words, the number one item listed on there is what they would cut first if we had our preference, and the number 7 and the number 12 would be the last cut on that 5% reduction. The next page is the same thing. Yes, of course. No problem.
So just so I have it in my head right, so you went through, you moved the money around, and then on top of that, then there was an additional 5% cut, right? And that's what's reflected here. So there's not another column, though, that then goes now, like the Alzheimer's program went, so it's minus, it's the $4,230,000, which was over here, and then there's an additional 5% cut of $627,000, right?
That's correct.
And then so now the recommended number will be the $4,230,000 minus the $627,000.
Well, actually, it'd be less than that because that was just the first 5% cut. We go to the next line, excuse me, the next page, and you will see that that same program is at the top of the list for an additional $152,000. Which the third page then represents what we would put forth in a second 5% round of cuts. And then to bring it all together, we would go to the last page on this document, and that's, Bobby, where you will see the revised amount if they took those cuts in its entirety. Gotcha. We don't have, you're right, we don't have a total after each cut. It's just in total there. Well, we have a total after each cut, but it's not reflected. It would. It's not reflected on the document. It's only reflected in the total 10% cut. You can see there, and again, the target is 10% of base. That is given to us by the LBB. In fact, when we enter this amount into the state program, the state what they call ABES, they have the target, and it has to equal to that amount, or we cannot submit our LAR. And so they gave us a target of $105 million, and as you can see, we have complied with that and put forth $105 million of cuts, if it comes to that. So for our base, that's our story. I'll be glad to answer any questions. The other thing we have to cover is the exceptional items, or that we should. Yes,
so clearly you're prioritizing on which to cut first. So if a cut comes in as less than 5%, then may not have to go to number 12. But in many of these, it's not reflective of a 5%. Some of them are 5%, but you have 23% for the JAMP and 57% of the Be On Time program.
That's right.
So you're really kind of factoring it on two different levels to get to that.
Yes.
Because it has to be 5% overall.
Exactly. 5% of the total.
Right.
And so then that's exactly right. If for some reason they don't take that, we hope that they stop. And that's why you will see the financial aid programs at the bottom of the list, because that is truly the programs that we want to protect at all costs. So we're saying, this is what we want to protect the most.
I think I said, or Duda said before you arrived, that one of the basic principles that we use to make both shape the budget and then make the cuts was the first principle was no across-the-board cuts, to preserve our programs that were particularly strong, cut the ones that were relatively weak, and preserve the programs that help poor students go to college and helped us achieve the goals of closing the gaps. So that's why there are differentials in the cuts.
Yeah, and I'm completely in agreement with those principles. Can I ask a quick question about the D110 professional nurse shortage? Can you speak to what that program represents? Because it's at least my perception or understanding that we still have a nursing shortage.
I can, but I'd rather not, because I'll probably get it wrong, Doctor. So I'm going to ask Susan Brown to come and address your question.
Just maybe why is that on the list, and are we really in the luxury to cut there?
That is a program that goes to the institutions for nursing shortage, help build more faculty for them to alleviate the nursing shortage. We keep up with how much it's grown. In the last time, they actually had not spent most of the money that had been allocated, because we do get an annual report from them. So we felt like that might be a place that we could cut.
Yeah, a sense of how much they had not spent?
I could get that for you, but I don't have it. We give them actually a 4-year time frame, so sometimes it will take a little bit of time for them to ramp up. If they know they're going to hire a new faculty, they may not be able to get that faculty started right away, and so they can put the money in, and they will leave that money to the side knowing that they're going to pay for that faculty out of the money.
So this
because
is more,
it is money that has to be spent in nursing programs.
So this is more to develop nursing faculty?
It's a nursing faculty program. It is not a scholarship for nursing students at all.
Okay. And we're not hearing from our nursing schools that they need more money, in fact, that they didn't spend all that we gave them last biennium?
I'm not going to say didn't say they need more money. They always say they need more money.
But for that purpose, they're clearly not attracting additional faculty and spending
They
the
are
money.
attracting some faculty, but they spread it out over time because they also don't know how much money is going to be given for the formula. So they kind of hedge their bets.
This program was larger in the previous biennium too, wasn't it?
It was larger in the previous.
I mean, we're keeping it flat at 30 in our base recommendation, but in the 2010-11 biennium, it was more than $30 million. It was
$49 million.
$49 million. So
Got cut back to
by having
30.
it cut from 49
Started
to
at
30,
6.
I think the institutions, were sort of ramping up and then had to ramp back down in a sense. So I think there's been a little bit of uncertainty, I would guess.
There is some uncertainty, and they actually split it apart. Not this biennium, the previous biennium, when they upped it to 49 million, 45 million, something like that. They actually started 2 new programs. So there had been an original program that was funding just on graduates, increasing graduates. So as you increased year after year, you got additional funding for each of those graduates that you produced. Then part of the money is now split to what we call an over 70 program and an under 70 program. And the institutions are divided by their nursing graduation rate. And so we split the money that way. A lot of institutions did not actually, they have to earn that money by increases in either enrollment or increases in graduates. And they did not earn all their money. And so we actually funded the maximum and then still had some money left.
Arturo, similar to the rider that we're going to try to get with the Armed Forces scholarships, can that money be redeployed if it's not used?
And we do have the authority up to 20%.
Up to 20%?
We don't need a rider for that. I mean, there's a general rider for that already.
So that applies to all of these programs?
It applies to any strategy, that's right.
Okay.
Also, if we might add that if our outcomes funding makes it through the legislature, that nursing is included as one of the critical fields.
Right. That's right.
Well, it sounds like we're already doing outcomes-based. If you're looking
We
at
are for the
graduation
nursing.
rates, is nursing the only programs that you're doing
That is
that
the
with?
only one that has been set aside, had money set aside by the legislature to fund it. It has got very specific rules in which the money that they receive from this program has to be spent in nursing, and it cannot supplement other money. So they have to spend at least as much as they had the year before on nursing, and this has to be over and above that amount.
Well, I'll just say that I have heard from nursing schools, and they have really been nervous because they took such a big cut after the last session. So it could be that that they really don't know that they'll have any future funding to continue to fund those positions. So you hate to start a class now, a 4-year class, you know, looking at your enrollment now and think that through 2 years from now you're not going to have funding to finish that class for them to graduate. So I would propose that we take money from the Armed Services Scholarship and at least keep this account whole. I really feel strongly about that, David. So.
Somehow I figured you'd
not
have
to
an opinion on
refund
that.
it to where it was. We can't restore it to 49, but I think we ought to leave it at 30.
You know, the only question I would have is how much of it did they not use? And
Well,
was it
but it
just
was
because of the permanence of the funding that they were leery of?
Right, it's a scare factor.
I
And-
completely understand your argument. I do.
May I point out, ma'am, that we are leaving it at 30. The cuts are contingent. We're not,
Right.
but
But
if
you
they
have
come
it
through.
prioritized up here in this, and you don't have Armed Services Scholarship. Now, are we required by law to keep the Armed Services Scholarship without a 5% cut?
No,
Or a
Well, I
second
think-
5% cut?
no.
Then why would we do that to the nurses?
You got to come up with 1.5 million to substitute those, and you clearly have that. Excuse me.
In the Armed Services.
Clearly have that within the 7.2 million or 7.12 million of the armed forces.
Or could we just exchange the professional nurses shortage and put it down, just flip-flop them
Yeah,
Flop it
chime
with
in a
me.
little
on the
bit here.
prioritization?
Well, either of those, this board could choose to do either of those. This committee could choose to recommend to the board to do either of those. Flip-flopping 11 and 12 in opposite order, and/or looking for part or all of that 1.5 million from other items that don't have proposed cuts in the first tranche. So while y'all think about that, I was going to comment that Arturo, Linda, David, I like this as a whole much better because than the initial 5% cuts, because we've kept B1, B13, and B14, the Texas grants, TEG and TEOG, all whole, at least the first round of potential cuts. And so I would say I like that because before we weren't doing that.
Well, because we were putting more money into the base for at least TEOG and work study, Texas grants, so. TEG, we did not recommend any cuts in the first 5%, but we did on the second 5% and kept them whole in the base.
Mm-hmm. And I think that in the second go-around, I like the fact that the TEG, TEOG, and Texas grants are all treated equally in terms of if we have to get to that. But it leads me to my question, which is y'all have had a week or so of legislative meetings. So what are the tom-toms and the tea leaves saying in terms of expectations?
Well, actually, we were received well. I don't think, we had some questions that we were able to address, but I think overall it was very positive. I think one of the questions that we asked was, how many other state agencies come to you to present before they make their decisions on their LAR, and they said none. So they really appreciated the fact that we were sitting down with them ahead of time before the board had made their decisions. There was some concerns expressed about the cuts to the Texas Armed Services Scholarship Program, in particular from the governor's office. So we adjusted that after talking to the commissioner, and there was some discussion about adding the need component in order to be consistent with our approach with the other programs. We had some other concerns about cuts to be on time, particularly from Senator Zaffarini's office, of course. She was the one who authored the legislation that created the Be On Time program in 2003. And as you know, Senator Zaffarini feels very strongly about maintaining the program as is and addressing the underlying concerns that Sunset identified in their report. So we have been talking to her staff about some of the ideas that we have with the the undergraduate tuition rebate program and the state subsidized loan program that you're going to hear more about tomorrow during the major policy discussion.
Actually, and we knew that by going out and making the presentations and sharing the draft, and we made it very clear that this was a draft, that the board had not acted on it yet. You had a copy of it, but had not acted on it. We knew that we were taking a risk of questions and criticisms or whatever you want to call them, but we still feel that this is the best decision. And we're transparent. We put it out there. It's our recommendation. The board will come in with their recommendations, and eventually the appropriators will, produce a final bill. So, but it was a good exercise. I think at the very least they appreciate that.
Did they express their appreciation to the Sunset Advisory Commission that we were out there getting stakeholder input and feedback? Maybe we should ask them to send a note.
No. I was just also reviewing my notes. I had an opportunity to sit down with Ray Garcia at Texas Association of Community Colleges, and he did provide some feedback on the transferring of the funds. Actually, he's the one that asked the question about whether or not we had transferred the same amount of money from Be On Time to TEOG as a result of the Sunset recommendation, which we agreed with, and we had not, in fact, done that. So we were very grateful that he had pointed that out. So that's why in the change, in the new iteration, we had moved that $6.9 million or so to TEOG to reflect that. I think his other concern in terms of the $35 million from Texas grants to TEOG was that we still have the majority of the students entering community colleges, and in terms of comparing the number of students or the percentage of students who are served through TEOG compared to those university students who are served in Texas grants, there's still an imbalance there. And so TEOG continues to be underfunded compared to Texas grants.
Is everyone familiar with these initials
Acronyms?
we keep using? I know most of you guys have been around now for new board members for 9 months, so you're veterans of the wars, but
Acronym war.
And Ryan is new, so why don't you briefly explain TEOG?
Absolutely. Texas Educational Opportunity Grant Program is the need-based grant program that is for community college students only. So they only have to have financial need in order to be eligible for the program. Texas Grant, I'm sure you're very familiar with, is it does have a merit component to it, and in fact is going to be going through some additional changes this fall as a result of Senate Bill 28, which Senator Zaffarini and Chairman Branch passed last session, based on our recommendations to include some more rigorous merit criteria in order to prioritize the Texas grants to students who are eligible. So those are the differences between the two programs, and what we're talking about with our legislative recommendations and making potential changes to the Texas grant program is one would be that Texas Grants becomes a university program only. And again, we wanted to make sure that we kept the community college students whole. So we moved those funds from Texas Grants to TEOG and from Be On Time to TEOG.
That way that there wouldn't be, the buckets would be separated finally, and there wouldn't be a mixing of scholarships. So.
I see that there are about 40 line items here. Have we looked at all these line items and see which ones are not used? Just like we found out that armed services scholarship is not being used. Nursing program is not. Why don't we cut down the program which are not being used? Have we analyzed that? I'm sure that analysis was done.
I think that's part of the process that Linda described earlier, that staff looked at every one of them. And that was the instructions from the commissioner. Don't just come in here and give me 5% of everything. You know, that's too easy, and that's not the right thing to do. So, yes, in answer to your question, they have done that thorough analysis.
Didn't either Sunset or staff identify a number of programs that had not been funded for years and that we're going to take those out and no longer report those?
Yes, that's
Doesn't that
correct,
speak
but
to
they're
what
not
Dirk is saying?
reflected here.
Right. So what Dirk is asking is some of those programs are not even on this list that are zeroed out and have been for a number of years historically not used.
Some of them were never even implemented because they never received funding.
Right.
So those will be cleaned up in the statutes through the Sunset Bill.
Are there some other programs like that over here out of these 40 line items where they can be discarded?
No, because the Texas Armed Services Scholarship Program still has students participating. It's just not the full 185 potential awards. So, for example, for FY12, we had, out of 185 potential nominees, we had 107. And out of that 107, only 76 students received scholarships. So that's what we mean by undersubscribed, because it's not 100% of the students receiving a scholarship.
Would, you know, with the rider that we're going to propose for that scholarship, if it goes another biennium without being fully subscribed, is there any reason we couldn't broaden that rider to allow us to move any unused funds into either the Texas grants or the professional nursing shortage funds?
There's nothing that prohibits us from doing that.
Our
We could do
analysis
that.
of the need at the time?
We've drafted the rider to say that the unexpended funds would go to Texas grants, but we can certainly add professional nursing shortage program.
It strikes me, maybe even with the same rider, we could do likewise if the professional nursing shortage funds aren't completely earned out. We could move those to Texas grants. Or conversely, if we do have to go to level 1 or level 2 cuts and are undersubscribed in the other program, we could sort of use those monies to restore those cuts. Mm-hmm. So maybe the rider should be broader and more flexible.
We can do that. Ultimately, it's going to be up to the appropriators to decide what they want. They give us enough flexibility of a 20% transfer. In order to, I guess 20% will maintain their intent of how they appropriate it to each of the strategies, and so adding more flexibility to the agency for transferring more than that obviously is a policy question for them. But we can do that, and we will.
I guess to speak to Fred's point, I think that we should ask for total flexibility, that to put it back into programs that are level 1 or level 2 cuts that we see that really have those needs, or maybe the nursing shortage is necessary at that time. But I guess I go back to how many of our programs are only being subscribed at the 80% rate? Because if there's programs out there that were not meeting the 80% mark, we're losing our flexibility to deploy those funds if they're not under that 20% exception. And so I guess that's a kind of a question to staff, if you can, off the top of your head, or maybe tomorrow we could have a report on which one of these are not being used, at least at the 80%, and that would require inclusion in this potential rider.
Did we identify somewhere? I thought we identified all programs that had a UB balance carryover. In other words,
well, we weren't given unexpended balance authority for any other programs except for one.
I guess we're conflating a bunch of different topics. So your questions are all good. We need to kind of step back a little bit of what we can do and what we can't do. We had very, very limited UB authority into the current biennium, and most of those were funds that were already appropriated, so we really didn't have true UB authority, which would, for normal use, it's you get to take your cash from this year into next year. So the current biennium was structured in such a way where we really couldn't do that for any of our programs. We have certain carry forward authority within certain programs between the fiscal years. So some programs don't have the ability to transfer money out of a fiscal year into the other fiscal year. And then the rider language we're talking about right now for UB into the next biennium, we can make recommendations. The LBB will tell us what we can and cannot do. So Linda's description of our recommendations for rider language are truly recommendations on what we would like to have happen. They really don't have much at the end of the day to do with what will really happen. And I guess I would caution on making a rider for a particular program being flexibly transferred into multiple programs, because I doubt the I wouldn't want that.
The broader we try to make it, the less likely it will be to be agreed to.
Well, there is, or you make it so broad that you literally have UB authority for all of your funds to UB into the following biennium. I mean, that's the ultimate, what would be the most flexible. So that would be the ultimate request that we would try to make. So back to your original question, though, about usage of funds, there really aren't any programs that go beyond that 20% figure. Armed Services Scholarship is unique because it was started up 2 years ago. It actually got an additional appropriation through SB 2.
In the special session.
In the special session last summer, so there were additional funds put into place to fully fund 2 full cohorts of new students. So as the discussion previously, we're running, 85 out of 185. So there was a lot of money put into it that's probably unique to these current 2 fiscal years, but it's not likely as we look at, as 13 occurs in working with the LBB, they will look at and say, how much are you going to need in 14-15 to fund renewal students or to fund your next pool of students? And then they may likely write the rider language for us that says you can UB $1.3 million, for instance, out of 12-13 and 14-15 specific to that program. So I think we're trying to create some flexibility in our suggested rider language, which is a good thing. But again, we are making suggestions, and our representative at the LBB is very receptive to all of our conversations, and they will adjust these numbers well into the session, and at the end of the session we'll still be making adjustments to rider language and getting the UB figures correct in such a way that it reflects the kind of current financial condition of each particular program.
I think if we could get the information on how much of this current biennium's $30 million for the professional nursing shortage has not been allocated, and whether or not it's near or substantially below or above that 20% threshold, that would be helpful.
And I think, just watching Susan Brown's head nod when I walked up here, we're well below that 20% figure on nursing. We're well above that on armed services, and the estimate that we had last week was about $1.3 million. So after we've transferred everything, at the end of fiscal year 13, we're expecting to have about $1.3 million remaining that we won't be able to transfer, and it will either lapse if no rider language is created, but I suspect that rider language will get adopted that will allow us to UB that $1.3 million into the next biennium.
So that is the specific amount, $1.3 million.
That's the expected amount, correct.
Expected under unallocated portion of the $30 million.
Untransferred UBable, if that's a word.
UBable.
Yeah, and to go back to that armed services, that's less than 40% subscription. And here we're talking about ratcheting up the criteria to gain that based on need. So, I'm not against putting a criteria of need in there, but some of the people willing to serve in the military may not have a quote need, even though they could use the scholarship, and we may have less than 40% subscribe if we put more rigid criteria in there in that regard. So I appreciate the information. I guess I understand now that's a unique problem to that program, and the rest of them have not hit the 20% threshold.
By far.
I see there are about 40 line items here. And probably 8 of those line items, which are high dollar amount, make 80 to 90% the dollar amount. Even 5% unused of $580 million is a lot of money. I guess you have done the analysis. What is the unused amount for these high dollar amount budgeted items? Like $580 million for the Texas grant, 168 for the tuition equalization grant, and so on. Have you looked at how much is not used?
We will use every penny, and if we don't use every penny within our transfer authority at the end of the fiscal year, we'll go in and look at, well, how can we use every penny either through transfer of expenditures to particular line items, or if we're short in an area, how do we could transfer funds to restore a particular area. So we very rarely ever lapse funds out of a biennia. Last one we did because of the very, very tight restrictions that were placed on our UB authority. So we tried to, essentially at the end of last year, we tried to spend and transfer as much as we possibly could. But
and how much was that?
I have to get the final transfer figure for you. It's
approximate.
I can tell you how much was left that we could not transfer any place, and I'm going to crane over my shoulder because I think it's about $2.2 million.
That's all. That's not a huge amount.
No, it's
well, and
out
it's
of $1 billion.
in a relative year. That's a lot because normally we don't lapse anything. Because we typically would have the ability to transfer funds into Texas Grant, which normally has UB authority into the next biennium. We didn't have that ability last year.
And just a clarifying question, but that ability to transfer 20%, that's within strategy category, or is that across all items?
Each strategy can transfer 20% per fiscal year.
Within the line items or to another strategy?
To another strategy.
Okay.
I guess I got a question now. Are we going to modify this thing, or we are going to seek a motion here for approval of the commissioner's recommendation? After all this discussion, are we going to, Arturo, David, and Linda, are we going to make some changes, sir?
It's up to you. If Ms. Shepard would like to place a motion to maintain the professional nursing shortage from the reductions.
That would be my proposal is, I don't know why we couldn't switch the positioning for the cuts, cut 1 and cut 2. Switch B116 with D110.
And on the second 5% cut, we have it as number 10, the professional nursing shortage.
Still in there, so I would just. So you're thinking it won't get cut? Is that what you're saying on the second cut?
I'm asking if you wanted to try and make a motion for that one as well.
Yes, that would be both places.
So moving it to 15 and moving them all up so that Texas Grant is now 14, professional nursing shortage is 15.
On the second one, you mean? I'm
Yes.
saying, well, I would just switch places with the armed services.
Oh, the armed services.
So it
Okay.
would leave it intact.
Okay.
And put armed services.
Got it. Okay.
Up there. That's how I would switch it.
So, right, now the dollar amount of $1.5 million will need to come out of armed services. Is that what you're saying? Okay. And same thing on the first 5% cut.
I don't know that that's 5%.
$1.5 million from armed services.
The only thing I would
It's
say,
not 5%. That's more than 5%.
Yeah, it would have
well,
to be.
it's
otherwise we'd
5%,
have
it's
to shift
5%
some
of the
other things.
nursing, but it'll be more than 5% of
Right.
the other program.
But it has to be equal, right?
The only
The
thing I would.
dollar amount has to be equal.
The only thing I would suggest is if this committee chooses to recommend that, that's $3 million, we can cut $2.9 million without affecting renewal students. So there's $100,000 we should, I think, if the committee recommends this, find $100,000 from somewhere else. In order, because that was the delta between renewals and
That's
and the new was 2.9.
Mr. Chairman, if I understood you right, when you were discussing the Armed Services Scholarship with the Governor's Office, they were very supportive of that issue. Is that what I heard you say?
It's our understanding that Governor Perry values this program very much so. So we're responding to.
By swapping this, we will be cutting almost 40% from the armed forces for the 10%.
Yes.
You know, there is another, again, remember, these are cuts only if the legislature decides to reduce the deal. Another approach, I mean, we do have to remember our First Lady is a nurse, but another approach would be to simply split the baby and the pain between both strategies. So I just offer that up as another consideration.
Let them work it out at the governor's mansion. Is that what you're suggesting?
I'm not making any such suggestion.
Just so you all have a point, this information, Susan just has brought to me that the nursing shortage had 621,000 left over in fiscal year 12.
That's a little bit more than 2%.
So the recommendation is to have a $750,000 cut each year. So this was for 1 year.
Well, so is there a motion or is there a?
Mr. Chairman, may I suggest that you really need to adopt, and whatever changes and so forth, but I also think you need to vote on the exceptional items. So if I may, I'd like to cover that, and then the motion can be made, either changes to that or adoption along with the changes. The exceptional items, because we have been held to base, we are allowed, or institutions and agencies are allowed to submit exceptional items above that base. And the coordinating board has proposed, or staff has proposed, 12 exceptional items. They are listed in this detailed document starting on page C1. It is a landscape right there, a landscape document that says 14, 15 exceptional items sorted by agency rank. In summary, and we'll go into as much detail or little detail as you need on this. Our number one, and they're by rank, our number one exceptional item is to put another $105 million biannual amount into Texas grant. One of the things that we have heard repeatedly, and there's been a lot of interest in, is that can we start, or should we extend Texas grants to perhaps the upper middle class? So students that make a little bit more money, but not quite enough money to pay for their own college. And so by requesting this $105 million, we're also recommending or suggesting that the expected family contribution be raised to $8 million, and that with this here, it would serve students almost at 100% of all eligible students. Remember, we're recommending four-year students only, four-year universities and colleges, and the new transfer students that are, if the legislative changes are made, will be eligible for Texas grant.
And that includes a reduced award amount.
And that's at a reduced award amount of about 3.8
$3,500.
$3,500 per award. Again, part of the commissioner's efforts to stretch the money as much as possible.
What was it last time?
$7,100.
The maximum award currently, Harold, is $7,100, and will go up to about $7,200 next year. However, if you recall, at the beginning of the current biennium, the commissioner sent a letter to the institutions, strongly recommended, and that was all he could do, just recommend and urge for them to make lower amounts in order to try to meet at least 50% of the need out there. I'm glad to, and I'm pleased to report that the institutions responded positively to that, and we think that they will be meeting 50% of the needy students by making lesser awards. So we hope that that continues.
Mr. Chairman, can I ask a question?
Yes,
What motions are before us right now? And that was, I think there's something different. Janelle has a motion, and if we could summarize and clarify it, maybe we could have that heard and then come back to.
I never heard a second.
Okay.
I'd be more than happy to second that, if it's not too late.
Bill, there's no problem having two motions?
We're not on the committee. So.
Hold on a second. Neither one of
We have
you
a
are.
motion from Janelle.
Well, you take one motion, typically you take one motion at a time, unless the second motion is an amendment to the first or some variation on the first.
It seems to me that there are two different issues on the nursing shortage matter and then coupling it with the reduction in the armed services scholarships. And maybe there's a solution here where we can take the nursing shortage off the table, but not necessarily be asked to target something that we were specifically given guidance on. Maybe we can just take the $1.5 million off and send the staff back to come up with another $1.5 million cuts and leave the scholarship issue alone. Seems to me that it addresses your issue, and we don't necessarily have to go head-to-head on the one issue we were given direction on, would be my suggestion.
But if I understood it properly, Arturo asked us just to hold off until he got all the exceptional items, and then we can make whatever motion we want and go from there.
On a holding pattern.
Do you agree?
I would, but I was trying to go back and resolve the one issue or the one motion that was on the table. So
That still doesn't have a second. He's not on the committee.
Who's on that committee?
You are.
Right, I understand. And you. All right.
So if I may just clarify, what you're suggesting is, we understand Ms. Shepard's concerns about the professional nursing shortage. Rather than tapping into the Texas Armed Services Scholarship, that we go back and look at the other programs where we could capture that reduction.
That's right.
And then bring that to you tomorrow as a full board, and you all can decide, whether that's acceptable or not.
If there was an amendment, if I could amend the motion as such, that's what I was trying to say.
That would be fine.
Oh, we have a motion with amendment, and
Yes, mine's the motion. She seconded.
and if there is no other further discussion, we can.
Well, I'm fine with seconding the motion. I guess I got confused because I thought we were going through exceptional items, and I just thought we were going to circle right back to Janelle's specific request after we covered that. I don't know if it matters one way or the other.
I was just trying to get a
Okay,
solution
sure.
out there for it because it was unheard.
I think we need it.
Well, what I viewed it as is when Arturo suggested that we go through all of the items and then kind of circle back. I took it when no one said to the contrary that there was general consent, and so that would be the approach taken. If that's not the approach y'all want to take, we probably need to back up. But if that is the approach, then each motion can be handled individually at the conclusion of the items.
To me, it appears that a 20% rider that we have, flexibility that we have, we can leave it alone and let staff make the corrections and amendment, and let's make a motion to, if somebody is willing to make a motion to approve the recommendations by the commissioner, let's vote on that, and then let staff make corrections later on. There is plenty of time between now and before it goes to the legislators.
But we have to submit the LAR through the web-based program ABES system by August 9th. So that will be submitted.
Maybe just a
at that time.
suggestion, Janelle, will you and Jim withdraw your motion and amendment, and let's move forward and
That's
get to the
fine.
end of
I'll
it?
withdraw.
Fine.
All right.
Okay, thank you. The total exceptional items are 160,472,000, and like I said, 105 of that, 106.5 of that is for Texas grant. If you want me to go through all 12 of them, or if there's any questions, we'll be glad to, between the three of us, address any questions you may have on the exceptional items.
And could you just, for educational purposes for myself, when we talk about these exceptional items, what's the likelihood or probability that this actually happens? I mean, and how's that process occur when we've submitted the other and we voted on that, and then it's like, oh, but how does this happen?
Well, what will happen is it will be submitted as the board's request, over and beyond the base. The probability, I think, is anybody's guess. I don't know. I wouldn't venture that.
It's all going to depend on when we get to the beginning of the session and the comptroller issues her biennial revenue estimate, how much general revenue dedicated is available for spending. And then the appropriators will then come up with an amount, and they'll work through that through the process. So this is a wish list, essentially.
Right. I guess that's what I was trying to understand.
And so it just depends on the budget forecast, and if things look good, we can, obviously the legislature is going to look at these and say, well, this is an important request, and we'll try and find money for this.
It's a wish list, but it's a reasonable wish list. I've seen other agencies go, ask for the moon in the sky. I'm not going to mention what agencies they are, but this is a constraint. I mean, we know we're working within tough budget times, but these are important. This is important to staff, and so it's a reasonable. Trying to keep it within reason.
Thank you.
Alonso, thank you very much. David, Linda, thanks a lot. And now, may I have a motion to adopt the Commissioner's recommendation regarding the Coordinating Board's legislative appropriations request for 2014-2015 biennium, please?
So moved.
Second.
We have a motion, we have a second. If there is no other further discussion, may I have a motion to approve?
I think we need to reconsider that because we didn't do Janelle's motion.
Does that address your concern?
I'm going to vote no.
Well, that was why I came back up. I thought that we were going to take up any motions at the conclusion.
Okay, and that's where I wasn't sure, because I keep thinking we're bringing this back tomorrow with those numbers.
That's what I thought.
Appropriately discussed.
But this will end up being a committee recommendation
Right. Okay.
to the board without consideration of the motion or another motion that would go forward tomorrow. So
could the motion be amended at this point with the second?
It can.
Well, why don't we amend it to take into account to find that $1.5 million cut from another area, instruct staff to come back to the full board tomorrow with
From
those
another
recommendations?
area other than the Texas
That's right.
Armed Services.
Other than the
That's correct.
Texas.
That's correct.
Yeah.
And just to clarify Harold Janelle's amendment that you're making on her behalf, are you talking about both 5% cuts, or
Yes.
just the first one, or just the second one?
Yeah, I think it was
The
three-quarters.
amendment needs to reflect.
It's 3 million total.
Okay.
Oh, we have a motion amended, and do we have a second?
Second.
We have a second, and now all in favor, please say aye.
Aye.
Any opposed? Say nay. Same sign, motion carries. Thank you.
Okay, so your direction then is, and your recommendation to the full board is that
I thought we were just picking up.
that we go with the commissioner's recommendation except for the $3 million cut and find $3 million elsewhere, and we'll have a revised spreadsheet with that, reflecting that amount. Thank you, Mr. Chairman.
Thank you.
Okay. Which one? What item?
Which will be number 4.
Yeah, we are going to take some more items out of the order because some people have been waiting here. We go to agenda item number 4, the audit report, and this will be presented by Susan Warren, partner of KPMG. Susan, are you here, ma'am? Anything else after that?
Yes, then that is number 5.
Susan, thank you very much.
Thank you. Susan Warren and both of KPMG, and we are here to present the results of the 2011 financial statement audit for the coordinating board. There is a presentation that's a summary of that in your materials, so we will be working off of that. The first page into the presentation is an agenda. What we start with is just a reminder of the responsibilities of management versus KPMG. We talked about that during the planning meeting, so it'll be very high level just as a reminder. And then we'll get into, if you will, what you're really here to talk about today is the results of the audit. We will let you know about whether we had adjustments or internal controls, changes in policies, estimates, and other matters. All these items are the things that we brought up during the planning meeting that are required communication when we finish an audit back to the committee. So we will work through those items. On page 2, management responsibilities. Your team here at the coordinating board is responsible for basically putting the financial statements together and creating those policies, looking at the internal controls, and doing all this in accordance with GAAP or GASB. As we mentioned during the planning meeting, there was a new GASB that we implemented this year, and so I'll refer to that in a slide later and tell you what the effects of that were. And of course, complying with all the laws and then making all the information available to us. On slide 3, what we did with that information during the audit was we took all of that, did our audit procedures on it as we described during the planning meeting, and formed our opinion about the financial statements. And of course, we did this with a reasonable and not absolute assurance in accordance with all professional standards. And then we're here today to do the last bullet on there is to communicate all the required communication back to you. Questions on just kind of the summary of what we talked about during planning before I get into the actual results of the audit? Hearing none. Slide 4. Here's the primary slide of the results of the audit. You have an unqualified clean opinion, which is what you want. That means basically the financial statements that you've been reviewing at your meetings were materially correct. You'll notice on here that we had no controls, issues to report, so there's no management letter. There was no significant deficiencies or material weaknesses, and there was no significant audit entries or things that got passed. Those would be called uncorrected adjustments. So in essence, that's a clean audit. It's what you want. Now, I know we had some conversations at planning about, well, do we talk about things that don't meet significant deficiencies and material weaknesses? Yes. We had some conversations with management about recommendations to enhance things that already are good, but ways that we think you might be able to make them even better. But those don't meet the definition of a significant deficiency, which is basically a hole in your control structure. So I just want to be very clear, there was no significant deficiencies or material weaknesses during the audit and no audit entries. That's pretty straightforward, but do you have a question? Okay. Slide 5 then. Yeah, usually not a question on that, but I always like to get the opportunity. The significant accounting policies and unusual transactions, those are disclosed in the financial statements. And as I mentioned, there was a new GASB implemented, which is the name of it's on this slide, fund balance reporting and governmental fund type definitions. Really what that does, if you're used to a corporate financial statement, you have your assets, your liabilities, and what most people refer to as their equity. In a government, that's referred to as a fund balance. And so it's basically what you have left over on your balance sheet. Those classifications of how that got presented was changed basically from 10 to 11. GASB came out and tried to make it more consistent with better definitions. It used to be that you would restrict things based upon encumbrances. So if you had agreed to, you had a lot of contracts out there for your loans and your grant programs, and you were going to spend this money, this cash, if you will, or investments you had on hand, you would show that, if you will, as encumbered at the bottom. So a reader of the financial statements would not think, oh, I've got all this money that, that is not dedicated to something. So that kind of, over the years, people put things in those categories differently. And so GASB 54 came out and restructured those definitions to make it more consistent. So now if you pick up governmental financial statements, they're all much more consistent. And so what you'll see in yours now is the word restricted. Restricted means that an outside third party, so somebody even like the legislature is really what it is here in Texas. The legislature has told you this money is for X. So you have the latitude of the 20% and things you've been talking about today, but really you have to follow the funding strategy. And so your financial statements now call those funds restricted, which would tell a reader that you're managing a program on behalf of somebody else. You don't have a whole lot of latitude of how you can spend that money and move it around. So it's a change in presentation, but in the footnotes, in footnote 3, you'll find all that described, you'll find all the definitions, and then you'll find all the programs that things are restricted for. Most of your money is obviously restricted for your loans and grant programs. Questions on that change? Because it really was a presentation change. It didn't change any numbers. It's a definitional change. Slide 6. We are required to report back to you where we see accounting estimates in the financial statements. As we talked about during our other meeting, they're the allowance for the doubtful accounts on the student loans. Basically, the amount you don't think you're going to collect is recorded in your financial statements. So we are required to take a look at that, look at management's policy for how they calculate that, compare it to our knowledge of the industry to make sure it's consistent. We did that and we found no exceptions in that policy, so basically no recommendations there. It is a reasonable estimate in our opinion. Slide 7, other matters. This is kind of the list of things that the standards say, if I have any of these, we're supposed to talk about them. So if you can see down the page, it basically all says none, which means we didn't have any difficulties, disagreements with management, consultations, other significant issues or things to discuss. There are a couple of things on here. The very first one that says other information. In your financial statements, there's an MD&A section, and there's also a required schedule at the back where you take your budget and compare it to actual. Those are supplementary schedules that are required to be there for GASB 34. We do look at those and make sure they're consistent with the actual balance sheet and income statement, and we did that without noticing any discrepancies. And then material written communication, that's a management representation letter that we also discussed during the first meeting. Management signs that at the end of the audit, basically saying that they've given us everything, they've disclosed all illegal acts, if there are any, they've told us about any control issues, they've told us about any communications with regulators, et cetera, and that has actually been provided in the detailed report for you to see. But again, it was normal, there was nothing unusual in that letter to report. That is our prepared presentation if anybody has any questions.
Susan, thank you. Do we have any questions for Susan?
Mr. Chairman.
Thank you very much.
Thank you. Appreciate it.
May I
Nope.
a quick word? And by the way, this does not require action by the committee. It's just a reporting item. There's a lot of people in the agency that should be given credit for this clean audit. A lot of people in the business office, the divisions working with us. So I really, if I may, Mr. Chairman, express my appreciation to everybody in the agency who had a hand in getting us to.
And let's not leave out IT. We do a lot of IT work.
No, it's across the agency. So
that's right.
Yeah, I really express my appreciation to everybody.
Thank you.
Thank you.
It's what every board wants to hear.
Absolutely.
Next agenda item we are going to take out of sequence again. This is Consideration of adopting the staff recommendation to accept a grant from the St. David's Foundation in the amount of up to $1,070,025 to administer a student loan repayment program for critically needed health care providers at non-profit clinics serving the underserved population of the following 5 Central Texas counties: Bastrop, Caldwell, Hayes, Travis, and Williamson. And Dan will make the presentation.
I'll be very brief. Over the last 3 or 4 years, we've developed a fairly efficient method to disperse loan repayment programs through the coordinating board, and we have a long list of various loan repayment programs in various disciplines, teaching, physicians specifically. About 9 months ago, perhaps, started talking to the folks at St. David's Foundation. I think they saw the fact that we had a methodology to disperse funds in a very efficient manner and started exploring the notion of having a loan repayment program specific to the St. David's Foundation, really tailored a little bit after the PELRP program, the Physicians Education Loan Repayment Program, and the Children's Medicaid Loan Repayment Programs. So we started talking with Dr. Roberto Rodriguez, who's here in the audience, if you want to just... And collaborated with them over a number of months and worked on a proposal, and this is essentially our request to the board to accept this particular grant to the coordinating board to manage this particular loan repayment program. And if you have any real specific questions, I'll be happy to have Dr. Rodriguez come up and answer them, because I will punt. So I would recommend your acceptance of this particular grant.
Do we seek grants like this from other institutions in Texas, other foundations in Texas? Is this a normal thing to do?
We have a grant seeking through Dr. Gardner's area, specifically through his office, and more higher education policy-oriented grants. This is a little bit different in that it's more of I call it more of a workforce initiative. We don't necessarily seek these types of funds. However, when funds present themselves in this type of a manner, we certainly are willing to explore them to see if they make sense within our current operation. There is a very small administrative fee that goes with this that essentially covers our expenses to run the program. So we view it very much as a win for the communities that it serves, a win for the physicians, obviously, that are beneficiaries of the loan repayment. And from our perspective, it allows us to better leverage our resources that we have.
All right. Thank you.
I move for approval.
Second.
We have a motion and a second. All in favor, please say aye.
Aye.
Anybody opposed? Say nay. So motion carries.
Thank you very much.
Thank you very much.
Now we are going to have agenda item number 3. I would like to call on Dr. Lanzo to introduce the topics of this meeting's reports, and he will provide us some background information. And this is only a reporting item. We don't have to vote on this item.
Thank you,
Dr. Lanzo.
Mr. Chairman. Thank you very much. We actually have 3 reports today, one of which I have already mentioned in my earlier presentation, which is Mark coming up and giving us his analysis of establishing a compliance and monitoring section within his department. But our first report is a report that is something that is very near and dear to my heart, something that I have always talked about, something that I am very passionate about. And those of you that have, well, I guess it's only Fred that has been here since I got here, may remember that from the first day I have spoken about a need to create a culture of excellence and to concentrate on continuous improvement and lean operations. I am very pleased, and it is my pleasure today to introduce The first presenter for this afternoon's report, Dr. Elaine Lang, is our newly hired Director of Continuous Improvement, and she arrived at the agency about mid-April, and she hit the ground running in order to launch our continuous improvement and lean initiatives. It is something that takes off where I've been talking, formalizes this process, hopefully takes us to the next level. It is a continuation on that journey that I have established, or that I have been advocating for, which I call a culture of excellence. And so Elaine will give a short presentation on her plans for the CB and respond to any questions that you may have. Elaine?
Good afternoon, everyone. It's a pleasure to be here. As Dr. Alonso says, I'm Elaine Lang. I'd like to tell you a little bit about myself because I am the new face here for you this afternoon. I've spent about 8 years at the Alamo Community Colleges, at Northwest Vista College specifically, working in continuous improvement. In 2010, actually 2008 to 2012, we went through a major reorganization and streamlined our registrar functions. And as a result of that, I was one of the 5 registrars who identified many processes that could be centralized and handled much more efficiently. So I'd just like to showcase a few of those results. The most important thing we did was we standardized the cycle time to perform what we call the final degree audit and award degrees and certificates to graduates. It was discrepant across the 4 institutions, and that was one of the first things we did. Secondly, we reduced the amount of time it took to print diplomas and mail them to students, standardizing that and outsourcing it so that we reduced our costs by 95%. We also standardized and centralized our reporting to the National Student Clearinghouse, so all 4 colleges were reported on the exact same day. And we also decreased our cycle time for resolving errors on those reports from 10 days to 3 days. Finally, we centralized outgoing transcripts, about 85,000 transcripts per year. And so our target, we set a target that every transcript would be out within 5 working days. And 90% of them are out in 5 working days as of now. And we can also track the transcript volume and cycle time by college and by month. So as you can see, I have some experience working across a number of different groups, streamlining operations. Let's talk about what's happening here and my proposals. First slide. I believe that a roadmap and a toolkit are required to take the coordinating board's continuous improvement efforts to the next level. The Baldrige Criteria for Performance Excellence is a respected and proven system for implementing continuous improvement in your organization. Most importantly, it is a sustainable system. It is not embedded within one particular person, but it's embedded within the culture of the organization. It is non-prescriptive. It allows us to ask questions of ourselves as an agency, depending on what we do. Many of you know it has been used in manufacturing, in healthcare and education, in government and service industries. I believe that our focus should be on Category 6, which says operation focus, and Category 7, which is results. That Category 6 just asks a very simple question. It says, how do we design, manage, and improve our key work processes? And the result of answering that question is we have measures that are reported in Category 7. If we use this roadmap, we're going to prepare ourselves for the next strategic plan, which will be in 2015, which the Sunset Commission really asked us to look at agency goals and functions and make that a critical part of our strategic plan. Now, Baldrige organizations also have a proven methodology for continuous improvement, and so what I would like to call the toolkit. And so let's take a look at what I recommend at the toolkit. That would be the next slide. Lean has been used across many sectors of industry, and I believe that there are 3 specific Lean tools that are best suited to the coordinating board and our next steps in continuous improvement. The most important is the value stream mapping or process mapping. And I gave you a very high-level, simplistic view of what that would look like in your presentation today. In between mapping process and removing waste, another critical lean tool is using what we call the root cause analysis. We want to make sure that we are really understanding what is causing the inefficiencies. It's very easy to react and just start taking actions, but if we use this methodology, we'll all have a good understanding and also be able to leverage it across the organization. The other very simple tool that is used in Lean is what's called Plan, Do, Check, and Act, PDCA, which just allows us to document our process improvements, which again allows us to leverage this learning across the organization. So value stream mapping, root cause analysis, and Plan, Do, Check, Act, and the roadmap are the foundation for our continuous improvement plan. I like circles, and so here's my first of what you might see as many circles. I am new to the agency from the inside. I'm very familiar with the coordinating board as an end user, one might say. I think there's 4 quadrants for a continuous improvement plan. The organizational assessment is the most important. I have been meeting with coordinating board staff, learning about operations and where they are in their continuous improvement journey. I've also reviewed the 2013 to 17 strategic plan, the Sunset Advisory Commission self-evaluation, and the report and decisions. And all of that has informed my understanding and my proposal here. The the continuous improvement plan will launch in August of 2011, and we do need to be mindful that the legislature will be in session beginning in January. That's a key process for the agency. Many staff will be involved, but I still believe we can accomplish some continuous improvement efforts and report those results in July of 2013 to the board. Having done those first 3 pieces, I would recommend that we become part of the Quality Texas organization. That's the state affiliate for the Baldrige National Award, national organization. It's a simple application. It allows us to identify our strengths and our opportunities for improvement and get feedback. So I'd like to provide just a little more detail about each of these 4 quadrants. You've been hearing all kinds of things in your tenure as board members. I'd just like to summarize a few of the strengths that I've seen just to showcase where we are coming from, that we have a foundation to build on. Information Solutions and Services uses agile project management to update and roll over the Texas Higher Education Accountability System, a more efficient way of doing business. We have a web-based system for core curriculum submission and program changes, web-based loan application and payments, and of course real-time and detailed budget information for managers, for budget managers. We know what our opportunities for improvement are. The Sunset Commission and our strategic plan have laid those out for us. And I wanted to look at where we are in terms of professional development. How deep is our learning across the organization in lean processes? That allows me to move into the plan. I do believe that one of the best investments we can make is training the coordinating board staff on those 3 key lean processes, using some departmental training to identify key processes. And then I'd like us to select 3 processes across the agency that we'll report to you in July of 2013. I really think this is doable. It's aggressive, but maybe I should say it's ambitious. But it's important for us to start putting our learning to work by analyzing processes and improving them. We'll be using cross-functional improvement teams. We'll be having interdepartmental meetings and sharing our learnings across the organization, and also leveraging our understanding of Microsoft, our use of Microsoft Office SharePoint. What are some of the results you can expect to see next July? These are not all conclusive, but we will expect to come back and tell you about process that we have streamlined. We'll expect to report to you cycle times and reductions in cycle times. And another very important result is customer satisfaction, and that might be an internal customer or an external customer. And all of these really allow us to just embed that Baldrige roadmap, that system, that structure within the way we operate as an organization. I'd just like to tell you a little bit more about Quality Texas. You may be familiar with it. It may be new to some of you. It has been around since the mid-90s. It awards Quality Texas acknowledgments in several categories. I would recommend we do the engagement level application. It's the first level. They also offer awards for commitment, progress, and of course the state award. There is a cost attached, and I think it's important for you to know that right now. To certify that we're eligible to submit an application is $200. When we submit our 10-page application, it's a $2,000 fee. And you may be asking, why does this nonprofit organization need that amount of money? And that's really to fund the operations of training Baldrige examiners and for the time that people are volunteering to review our application and give us feedback. I see this as a sustainable system of continuous improvement, which is really what we're looking for. We're looking to be the model for other state agencies as well as other states, that higher education can be efficient and can tell its story compellingly. I've given you, the last page is the links to Quality Texas, as well as to highlight just the 3 higher education organizations that have won the Baldrige Award. They all set out not to win the award. They set out to be the best and the most efficient organization they could be. The first was the University of Wisconsin at Stout in 2001. The second was the University of Northern Colorado College of Business, which was in 2004. And then I feel like we should have a drum roll here. Proud Texas moment. Richland College in Dallas, which won the award in 2005. And all of them said, and especially Richland, I was in contact with them recently, they said this Baldrige model, this quality improvement journey has allowed them to sustain significant organizational change. Their president, who has been with them for over 30 years, retired due to illness a few years ago. They had an interim president, interim vice president for teaching and learning, and they also had 134 faculty and staff take an early retirement. And what they said was they're still staying our course because we have embedded this within our culture. So having given you the high-level view of continuous improvement plan, I'm very eager to get your feedback and your comments. Thank you.
Any questions for Elaine?
Elaine, I have just a couple of questions, but first a comment that I'm really pleased, Arturo, that we've talked about this for quite some time, and the follow through and the fact it's now a reality is pretty exciting. What'll be more exciting, of course, for the results we see next July and in the interim. You mentioned some areas for continuous improvement effort. I would just ask that when you put I don't know what you're going to call the continuous improvement events, whether you call them Kaizens or whatever you may choose to call them, but I'd like to see the schedule of those once they're established. And in fact, I would like that information shared with the whole board. And on that schedule, I would like what the objectives, the targeted improvements are for each event. Mm-hmm. So that we can kind of judge just how challenging we're aspiring to be. And then in terms of results, I would also encourage, in addition to what you've got here about streamlining process, cycle time, and customer satisfaction, adding financial targets where it's appropriate. That might be anything from measuring savings because of a streamlined process. And so I think you would have both an objective and later audit the result to see did the improvements achieve what we set out to achieve. It might be we drove up the productivity of loan applications without adding time or FTEs or what have you. So it might be a productivity measure like the cost per loan application dropped because of improvements in the process. But I think everybody understands numbers, and so I would just encourage adding, again, where appropriate, it won't be appropriate for everything, financial goals and then measuring how we do on those.
Yes, sir. Thank you for that feedback.
I have some experience with the Malcolm Baldrige Award. Back in mid 80s or late 80s, there was a company called Wallace Company. They got an award, and they went around the country, all over the country. Their CEO, managers, everybody was showcasing how they got this award. In that process, they ignored the business. So I think it's really important to remain focused in whatever we are doing and keep on measuring the benefit or the as we go along. Otherwise, we can get defocused and keep on telling everybody how great this thing is. And Wallace Company went out of business. This was a huge company. I don't know.
They improved themselves right out of business.
And we had started Quality Circle at our place back around that time. All the employees who were member of Quality Circle, they quit. All they talked about in Quality Circle, how to get more pay for all of us. So I think it's that was a negative experience that we had. But Wallace Company was a well-known company. I don't know if any of you have heard the name of this company. This was a national distributor of piping products. And so I think it's very, very important to remain focused and measure performance.
Well, I'll just say that I'm in an organization right now. We've been doing the Baldrige for 2 years in the process. And I think especially for a large organization, it's a great process. It teaches you to turn over every rock. Look for leakage. Look for all your inefficiencies. And the process itself, whether you ever get the award or even never apply for the award, the process itself is so valuable. So I just want to commend Arturo for doing this. Good leadership.
Thank you.
You know, I think that's a good illustrative tale. I'm not that familiar with the Baldrige Award per se, but I can tell you that in my organization we've used continuous improvement processes over the years, and at times we've been able to increase the throughput of a particular product line 40 and 50% without capital investment because of these processes. On the other hand, what you will find is that you'll go, and you've probably experienced this, Elaine, you'll go through the initial dragging of the skeptics along with you. You'll punch through that wall. You'll have, after you're maybe 6, 9, 12 months into it, begin to have some success. And then after 2 or 3 years, there's a tendency for an organization to go, oh, we got it now, and then backslide in some areas and try to shortcut or not standardize the improvements and then improve them again when it's. So sustaining the board and the agency from top to bottom, side to side, need to understand this is a journey and a cultural change. It's not, let's implement this program and check it off. If we do this right, this will be something, the way the agency operates from the rest of time.
We must catalog our changes, the improvements that we have made, so that we don't keep on rediscovering the same thing every year. This happens many times, and it's really important to make sure the ideas are implemented all the time.
Thank you, Mr. Chairman.
Thank you, Elaine. Okay, the next report is our standard quarterly financial report. I sent this out, I guess, about a week ago to you electronically, but we also put a copy here at your desk in case you needed to refer to that. This is our, like I said, our standard quarterly financial report. Includes the status of all of our funds, including our loan funds, our loan programs. It says of June 30th, 2012. And if I may summarize, this is sort of to the questions you were asking, Dr. Tischer, earlier about how do we monitor whether we spend the money and so forth. This is one of the tools that we use, and it keeps us on track. I'm happy to report that we are on track to spend all funds by the end of the fiscal year. I've gone over this report before. I'm prepared to answer any questions that you may have specific to any page or any one-line item. But Also, as part of the financial report, since I mentioned the loan funds, I would like to announce to the board that this morning at 10 o'clock, we had a very successful closing on our 2012 bond issuance. We priced back on July the 10th. We held a competitive sale, and we received very competitive and favorable bids. I'm happy to report that we achieved a true interest cost, a TIC as they call it, of 2.74%, which is very, very good, and very, very good for the students, because this will enable us to continue making low interest student loans to the students so they can continue their education. I believe, Sharon, we have one page that we're going to pass out that gives you a little bit more of the details on that. It's just a few bullet points, but in summary, it was a good experience. I'm sorry?
What was the term?
The term was that 30 years? 20-year term. And so got a good discount. We received $100 million, got a discount of about $15 million. All of this is on your page there. But this is a good time to be selling bonds. And we had a good experience. As some of you know, well, most of you know, you might not remember, we have a new bond counsel and also a new financial advisor for this sale. We were very pleased with the work that they did, and obviously the results show that they did a good job. Mr. Chairman, that's my financial report. I'd be glad to answer any questions on that or on any aspect of it.
Thank you, Arturo. Thank you. So next item that we have on agenda is 5B.
No, we have one more report under Deputy Commissioner's report. Okay. Again, I mentioned this earlier. You will recall that the Sunset Commission report recommended that the coordinating board establish a risk-based, agency-wide compliance monitoring function to oversee our trustee funds, specifically financial aid, and the data that produces formula funding for our institutions, because those are huge amounts and very important. The Commissioner tasked Mark Pell, Director of Internal Auditing, to study and recommend a model for implementing this recommendation. Mark has concluded his analysis and has submitted a recommendation to the Commissioner, and the Commissioner has requested that Mark share that with the board and answer any questions. Again, this is a reporting item only, no action needed. Mark?
Thank you, Dr. Alonso, members of the committee. I would like to brief you today. This is a no action required briefing. And it's really, as Dr. Alonso just alluded to, it's to let you know the current status of our efforts to address the Sunset Commission recommendation number 5. That particular recommendation said that the coordinating board's limited monitoring of funding and data fails to ensure their appropriate use and accuracy. So what Sunset was recommending because of that condition is really threefold. They had 3 recommendations. First was they recommended the establishment of a centralized compliance function, or compliance monitoring function as they termed it. Second, in the establishment of that function, they recommended that it actually be funded not out of new appropriations, but rather to carve the dollars out of financial aid funding and formula funding. And then the third aspect of the recommendation was that through the establishment of a compliance monitoring function, Sunset felt that in relation to that, internal audit would then be able to focus more on internal aspects of the agency's operations as opposed to what has been the past practice here of performing a substantial amount of audit work that's focused on the institutions of higher education. So it was really sort of a switch or a change in roles of internal audit, getting back to looking at internal processes, and then as the compliance function comes online and becomes mature, that it would be able to focus on the outward-looking compliance at the institutions with, in terms of their data that they're reporting, and in terms of the dollars that are flowing to those institutions for the various financial aid programs. So what we did, we took the condition and those 3 recommendations, and I visited with a number of our key stakeholders, including State Auditor's Office, KPMG, officials within our own organization, really to try to figure out 2 things. One is we wanted to create an action plan that certainly addresses the risks or the condition that was disclosed by the Sunset Commission. And then secondly, we wanted to do that in a way that that was an appropriate fit for the agency. And so we looked at a lot of different models, some of which were mentioned in the Sunset Commission's report for compliance monitoring functions, many others that are in existence around the state and around the country, both in other agencies as well as other higher education institutions. And so through that assessment, in your materials, I would call attention to the action plan that we're moving forward with, and that you'll see an organization chart. And what we are moving forward with is an expanded Office of Audit and Compliance. And I would like to talk a little bit about that action plan and kind of where we're at with that right now, and then certainly address any questions that you may have. An expanded Office of Audit and Compliance has some clear advantages for the coordinating board. There were certain aspects of the recommendation that we needed to be able to address. One of them was to have a compliance function that was visible, a compliance function that had the ability to work with our programs, whether those be on the operations side of the house, areas that might be under Dr. Alonzo's purview, as well as the programmatic or academic side of the house under Dr. Gardner's purview. So we really needed something that was structured and staffed at a level that would be able to look across those organizational lines. Another aspect that we certainly considered was just the ability, already a built-in mechanism through my current reporting relationship to the board for matters related to audit. It seemed like a natural extension to be able to expand my role, and so rather than coming forward periodically with the audit briefing, which I will do here today, I could, actually just add an additional briefing that would be matters that are pertinent from a compliance standpoint. We looked at the number of the size of the function, and so the Sunset Commission recommended 4 FTEs. We've done some benchmarking analysis. We've looked at the numbers of compliance monitoring staff that are in other state agencies and other institutions of higher education. Ultimately, we came back to and are moving forward with a recommendation for 4 compliance specialist positions. Those 4 individuals would report directly to me, and because of the Commissioner's commitment, not just to address the Sunset recommendation, but really a business commitment, a focus to be able to be compliant and be, show stewardship of the assets that we're entrusted with. He wanted to go ahead and move forward. The Sunset process is lengthy, but his directive to me was to come up with an action plan and get started on implementing that plan. And so we have already, through the Commissioner's efforts and directive, 2 positions have been created from within. And I can say within a matter of days, those positions will actually be posted, and we'll move forward with filling those positions. So we're excited about the prospect of really enhancing our efforts from a compliance standpoint, and getting started on this effort immediately. And I would certainly be happy to entertain any questions or comments.
May I clarify one? We actually have found funding for 2 positions, not all 4.
I'm sorry, two currently, and then I believe the other, the actual entire amount is contained within the special items
That's right.
list
That's
that we
right.
looked at earlier.
But to start September 1, again, like Mark says, the commissioner didn't feel that we could wait till this process goes through this request goes through the process. He asked us to look around. We found two positions, one in Linda Battle's area and the other one in Dan Weaver's area. They had some vacancies that they were glad to give. Well, I don't know if they were glad, but they gave up the FTE and the funding for it, and so we will start the compliance monitoring shortly after as soon after September 1 as we can. So I just want to make sure that we didn't find funding for 4. Just
Not to my knowledge.
But we will ramp it up hopefully
Yes.
after the legislature comes in with the funds.
So the funding, though, for all 4 positions is in the exceptional items?
Yes.
Okay. Well, that we may be asked about how we found 2 of the 4 positions.
Right, and that's not to say that the positions that we identified are not needed. We just prioritized, and we still need those positions. But so this, I guess we could see that as a temporary loan of funds, interest free, and temporary loan of the FTEs, and hopefully we'll get funded at our request.
It sounds like Dan and Linda now have an opportunity for continuous improvement.
Yeah.
Absolutely.
Maybe you can find some more money somewhere else. We have a lot of agenda items still left. Do we have any questions for Dr. Alonso, Mark, or other staff members? As stated earlier, this is only reporting item, doesn't require any vote. You can move on to the next agenda item.
Thank you, Mark.
Thank you.
Okay, Mr. Chairman, that concludes the Deputy Commissioner's report, and I think we're ready to move to item 5B.
Yeah, item 5B is consideration of adopting the Commissioner's recommendation to the committee regarding a request to extend the contract for the HAMES student loan software annual usage and support fee for the fiscal year 2013, with the total for the year not to exceed $1,150,000. Dan will make the presentation. Dan, thank you.
I wanted to go back, Mr. Lee, to your question about the term of the bonds. I pulled them up real quick. It's 18 years instead of 20.
On the summary, yeah.
Okay. We actually moved up some of the maturities into the 2018 to 2020 because we had a dip in our debt service payments there to take advantage of the short end of the curve. So that's one of the largest reasons why our tick was so low, because we moved some of our payments up into that earlier time frame. Of course, the market moved away from us last week, so we missed it by a week. This request, we have a contract with, I guess now it's 52, they're Nelnet now, I believe, is the parent company. In 2006, we entered into a contract with a 10-year contract, essentially, with annual renewals. So we're in the 5th year of that 10-year renewal period. We are, as the chairman pointed out, it's a learning as we go process, and we continue to find various efficiencies within the system as it's currently configured. The amount of money that we currently pay for the system is based on our portfolio value. So as our value of our loan portfolio has grown, that marginal cost increase is captured within the particular agreement that we have. On an aggregate basis, over all of our operating expenses, we run at about a 1.25% operating expense to our portfolio balance. This represents 5 basis points of that 1.25%. So it represents about 10% of our total operating expenses, and our total operating expenses is about 1.25% of our portfolio value. We have met with the supplier of this particular software package. Sid and myself met with them this year, trying to explore opportunities to lower our cost. The market that we are operating in is shrinking So there are not very many players that operate auditable student loan packages that are available for essentially for licensing. Typically, as we've had meetings with firms that we might be interested in talking about licensing a software project, they typically want to talk about outsourcing, and we haven't wanted to go that far at this particular time, but ultimately that's a consideration the board will have to wrestle with over the next few years. Various states operate in the same manner that we operate. Alaska uses the same software package that we do. They have a very similar type of a loan program that we do. Minnesota, on the other hand, has a very similar loan program, and they outsource the bulk of their loan servicing. So those are essentially the two options that are out there. At this particular point, given the transition, the painful transition that we went through after running on a mainframe for 40 years, I'm very comfortable that we're in a very stable operating environment. We have some other agenda topics that we'll talk about, and we can get into more details if y'all want to talk about more details. But I would recommend that we continue this one-year annual agreement. We come back every year, so we have an opportunity to have this discussion every year. At this particular time, we really don't have a viable candidate that we could go out and compete with, but we are looking. And I'll ask questions, or I won't ask questions. I'll hopefully answer your questions.
Mr. Chairman?
Yes, sir.
Dan, how many loans do we have in the portfolio?
The last number I saw said 360,000 total. Okay. 366,000. It's on the agenda item.
Yeah. So basically, with the new loans that are being made, I would, then of course you've got decreasing balance on the other end. But with the, is that 366,000? Has that number grown dramatically?
We've grown in the last 4 years. Our portfolio balance has gone from.
Okay, but has the number of loans increased?
The number of loans, the number of students in the system, yes. I guess our
okay. Well, let me just. The purpose of my question is, it would seem that there's almost a built-in, of course, depending on the size of the loans, it seems like it should be transaction sensitive instead of the size of the portfolio. If you had
and we're not.
If you had 100,000 loans, at $850 million, or 500,000, it would be the number of transactions that you process, and the dollar amount itself doesn't seem.
Well, and we don't disagree with you.
Right.
The structure of this contract was set up to be based on portfolio value. It essentially encourages entities to grow, which we have over the last 4 or 5 years. Your point is exactly the point that Sid and I made to this particular vendor. Their business model is built around student loan portfolio that grew up from the 60s. So it's not based on your logical conclusion. It was based on their logical conclusion a long time ago.
We have to look at cost per loan to service. As far as the entire transaction is concerned.
Well, we do. We actually have recommended a performance measure in the latest update for the loan program, specifically to actually call out an operating expense so that we can track that. The LBB can track that. So when I go back and look at how are we doing relative to kind of what the portfolio balance is, our operating expenses are trending down over time, even though this particular piece is going up. So we have positive overall trends. What this particular package has allowed us to do is to become more efficient with our FTE count. So in 2006, we had 96 FTEs in the loan program. and we currently have, I think we have 71 and a half that are allocated, and I think we probably have 68 filled positions. And as positions free up, either through attrition or retirement or whatever, we go back and reassess what the needs of the organization are, because they change because of the operation that we currently have. So our FTE count continues to shrink, and I primarily base that on the fact that we have a very stable operating platform. It's scalable from an FTE standpoint. We do pay them a premium to offer the ability for us to grow, but we don't have growth in our other expenses as a result. So we have a fairly fixed operating expense structure with the exception of this. I guess.
Dan, let me just reemphasize what Harold said. In last 6 or 7 years, the tuition has probably increased in the state of Texas somewhere close to 50%. That means the scholarship amount has also increased about 50%. So this purveyor is basically charging us 50% more fees for the same loan. That's pretty steep. Approximately about the same.
Well, and again, we agree, and unfortunately, the few firms that have products, the one firm that we felt like was closest is not at the point of being, they don't have a marketable product at this point. The last time we talked to them was December of last year. Essentially, we are exploring and are open to looking at other operating systems. And the Nelnet came back and offered us a longer-term contract, and it capped our growth, the penalty we pay for growth at a much lower basis point rate, but it was locking into a 5-year contract. We are at the position where we don't want to lock into anything other than a year, because when other products potentially could come available, we want the flexibility to go explore them. So this is exactly the same contract structure that was in place in 2006. They have not been terribly sensitive to our request to alter the structure of the contract in order to reduce our expenditures. So I don't feel like we're being held hostage by any stretch of the imagination. But there aren't a lot of options available.
Well, I'll differ with you as far as not being held hostage. But going back, I think if we're gonna find some new purveyor to do this thing for us, we may have to allow multiple year contract, at least at a get-go position, 2 or 3 year to start out with, and then have an option. But let me change and ask you something else. Minnesota, have you all made contacts with them to see how their outsource working?
Sure. We talk to them every month, actually, through a consortium of state lenders, and I think I've mentioned that in previous conversations. Their business model is, when you look at it on just digesting it down on a cost basis, they spend about as much on their outsourcing as we spend doing it in-house when I accumulate all of our operating expenses. So that ultimately that's a bridge that we're going to have to cross, and I think it's going to have to be crossed in the next couple of years. We're hopeful that there will be a supplier that will step forward that's got a product that's auditable, that's going to comply with all the federal loan requirements, because ultimately the Department of Ed and KPMG come in and audit us every year. So we can't go with a startup firm necessarily. We have to go with somebody that's been in the business for a fairly long period of time, and that pot of people is shrinking. It's not growing.
But there's got to be some other option. Hopefully by next year, we are in a better position to do something.
Well, it's something that we look at frequently, I guess, for lack of a better word. And I think we've created sufficient exposure within our performance metrics that we've asked for. We asked for them to be included so that the legislature and y'all can see how are you performing relative to kind of what your targets are.
We have been paying the same amount for 5 years in software business. costs are going down from one year to another year. I think we should be able to push them to lower their price to us. We have had contract for more than 5 years, according to what I learned from you and Dr. Alonso. I think this is, if they're asking for the same amount of money, depending upon the balance amount, like Harold said, that it should not be function of the balance. It should be function of transactions. I think we must try to negotiate more aggressively with this vendor. Or maybe there must be some other vendors who are willing to come in. And in 5 years, softwares get stale.
But we completely agree with you. I think our concern is that we can't venture into a less expensive, riskier software that doesn't perform like we expect it to, and that it doesn't comply with our audit standards that we currently have. Because we can't have the Department of Ed coming in and shutting us down, essentially. I mean, worst case scenario. But we agree with your points, and Sid is probably the most aggressive, taking your exact same tone. So I think we're working in that direction. I just think our options are limited, and I don't want to be so aggressive as to not have a viable product anymore because they've completely turned their back on us. Because we really don't, at that point, you really don't have any options.
Mr. Chairman, I think, the audit report is indicative that we're doing a good job. I mean, so you can't really complain about what the software is doing. It's doing its job, with obviously adequately trained people. But I do encourage you to look at other options. If I'm understanding what you're saying right now, there aren't any options for us to do at this point, and you're recommending that we approve this contract, and in the next cycle.
Yes, that's my recommendation. Again, we structured this with annual so that we would come back to you every year and present this topic. This discussion helps us, obviously, to have another conversation with our supplier of this particular package, but it also puts us in a place to continuing to have conversations with potential other software suppliers.
Based on that, Mr. Chairman, I move to approve.
Do I have a second? Everybody in favor, please say aye.
Aye.
Motion carries.
Thank you.
Thank you, Dan.
Next agenda item is item 5C. Did we cover this or no?
No.
Is consideration of adopting the Commissioner's recommendation to the committee relating to the report on financial aid for college students in Texas. Fiscal year 2011, House Bill 1, General Appropriations Act, Rider 31, page 3-52, 82nd Texas Legislature. Dan is going to make the presentation. Dan.
In the trying to keep it short and be sensitive to your time, we sent this report out a couple of weeks ago, I believe. This is a statutorily mandated report. The structure of this report is very factual basis on what happened. It doesn't really talk at all about what's going on in current fiscal year 12. It's very much this is what happened in fiscal year 11. I have a bunch of slides to go through, but I think we're going to talk a fair amount about financial aid tomorrow. I don't know that any of these slides necessarily will help in that particular discussion. So unless there's a specific request from somebody to talk about a specific chart or graph or page, I would ask for your approval to approve this particular agenda item.
I only wanted to know, was there any change from the draft, the one marked draft that you sent out versus the one that's been handed out at our desk today?
The chart that had unsubsidized and subsidized flipped, I think on the last chart. There was a flipping of unsubsidized and subsidized Stafford loans on page 21. That was actually one of the few charts that I was going to talk through because it's germane, but we can talk about it tomorrow.
Well, it looks the same to me.
You may have the new version. Okay. Sharon says you probably have. That change was corrected, but I don't know which
You're going to
copy you
speak
have.
to it, in 60 seconds or less. Go ahead.
Well, does everybody have page 21 out of this particular? Sharon, do you want to turn the PowerPoint on and flip to the last? Yes. You want to flip to the last chart?
Page 11 on the slides is the same as 21 in the book.
Yes. So this is since we're talking loans, this is the national loan chart that compares federal loans, federal plus loans, which is the green line, and then the background colored in area that says non-federal loan state. That's where the Henson Hazelwood loan program resides. So you can see these are millions of dollars on the left-hand column. So fiscal year 08, there was approximately $24 billion of private loans within the national marketplace. And with the implementation of the reauthorization of the Higher Education Act that described federal loans and then other loans as being private loans, of which we are, then you can see obviously that there's been a tremendous drop of private loan volume nationally. Our volume in the state has been fairly consistent over that time period. Actually, it's gone up a little bit in that time period. But the federal government really set the program up to really put financial aid offices in a place where they package federal loans and they package federal Parent Plus loans preferentially to anything else. And on the surface, that's good for students and it's good for parents and it's good policy, except for the fact that they've lumped state programs that tend to mirror what federal programs look like. So borrower benefits that are representative of federal programs, they've disadvantaged the state programs to the point that many states' volumes has dropped by 30 or 40 or 50%, which is the case in Minnesota. So we continue to have dialogue with offices in Washington. It's a laborious process to lay out the groundwork to make the type of changes we're recommending, which is essentially to identify state loans within the federal language so that we are in a better place so the financial aid offices can essentially talk about state loans, which tend to be, in our case, much more attractive than the federal alternatives. The commissioner, I think, was last in Washington in February, and he had conversations about this very topic. Again, we have other states in a similar position, and we're all kind of working the Washington political scene, trying to find an end to get this change made.
The only other thing that I found interesting was on, I think, page 17 was the fact that even though we talk about what a bargain our community colleges is, the gap in available funding is actually greater for community college students than it is for four-year institution students on average.
The structure of that chart is the aggregate value of cost of attendance is the red line, and then the aggregate value of grant aid, loan aid. So that differential there is essentially students choosing to live with 3 roommates and eat noodle ramen and work and find other ways to fill up their financial resources in order to attend community colleges. So the gap there is really student choice, not so much availability of funds.
And does it include all students, I mean, in other words,
This is a accumulation.
regardless of completion and.
Yes, this is a snapshot at the end of fiscal year 11 of what happened in fiscal year 11. So it totals up all of the aid that was dispersed to community college students in that particular case, and how much their cost of attendance was that was reported to us through the financial aid database. I think I view that gap, and Jane might argue with me, those are students finding ways to do more with less. So they have obligations, whether most of the time it's living expenses, that they forego things or they work in order to cover those expenses as opposed to borrow.
And so they're choosing to borrow less.
They're choosing to borrow less, especially at community colleges, which is good in general.
Move to approve.
We have a motion to approve and second. All in favor, please say aye. Motion carries. Our next agenda item is under agency operations is item 5D is consideration of adopting request to approve additional funds to pay for anticipated increase in usage of the online loan payments service offered by the agency to its student borrowers. And Dan will make the presentation.
This is a contract that we have with NIC USA, which is texas.gov, essentially. Allows our student borrowers to go online and make payments on their loans. They have the ability to make one-time ACH payments, and they can also use a credit card if they choose to do so. We launched this last summer, and obviously having online payments is a good thing, so it's been widely accepted, and it's been used fairly substantially, which is one of the reasons why our expenditures are going up. It is a borrower benefit to our students that we eat the cost increase. We don't pass that increase on to the students in any way. The structure of the contract is really financially, NIC USA is very competitive. We don't have a choice of who we're using, but they're very competitive in that they charge a 25-cent ACH charge. And then if a student pays with MasterCard, then there's a 2.5% or 2.25% charge whenever they use a credit card. So it's very much like a normal commercial transaction. So we're monitoring this on a monthly basis. We made the decision when we launched the program to eat the additional cost, and we'll continue to do that, and we'll continue to monitor to see if anything is primarily looking at if we have huge credit card usages to pay off large balances, then we may have to go back and look at it again. And I would ask that you approve this.
Do you already have this in the budget?
Yes, ma'am. This is in our operating budget for the loan program, and I guess I mentioned previously we have we have targets from an operating expenditure standpoint. So when this has come on, whenever we have.
Just need approval because it's over the threshold of amount?
It's kind of like the post office. We mail stuff out. You don't really have a choice of paying for postage.
Right.
But because the contract is a pay-as-you-go contract.
No, well, why do you need board approval?
Because it's going to be in excess of $100,000.
Oh, okay, that's fine. All right. I move.
Just real quick, so is it MasterCard, Visa? What all do we accept?
I believe it's MasterCard, Visa. There's one that we don't accept because it's a
American Express?
We don't accept American Express. It's a different charge to the students.
I don't either.
What percentage are we paying? Excuse me.
Do I?
Yeah, that's how I pay your bill every month.
What's the percentage we are paying?
We pay the credit card 2.25%, I believe, and then the transaction cost for NIC USA is 25 cents. So the nominal charge that we pay, the actual texas.gov, is minimal. Most of the fees go to the credit card companies.
Is 2.25% a reasonable price? Can we get lower price than that, Harold?
That's reasonable.
You are in financial business?
No.
You get a break?
Well, Mr. Chairman, I think you can get as low as 1.8 discount on those. I mean, depending on who's your provider. That's what we do.
Okay.
Of course, we work through
1.8%?
Hilton and,
Especially with the volume that you may expect.
Yeah.
Our volume must be big. What's the volume per month?
Actually, our volume is not very big relative to Hilton. We're running $20-something thousand a month of charges.
Charges?
Of what we owe to Nick USA in order to have this service. So it's nominal, I think. I don't know that we're going to have a lot of negotiating power with
20,000 in fees or 20,000 in total charges?
fees.
Fees.
That's pretty steep.
That's a lot.
Yeah.
That's pretty steep.
If you can get a 10%
Be able to
break.
get that.
Okay.
I mean, again.
Well, again, we'll contact Texas.gov, and again, this is a contract that we have through them. So we'll express our opinion that they're charging us too much. I don't know that I don't think we're the biggest client of Texas.gov, so I'm not sure how much we're going to be able to squeeze them. But if y'all want to make a phone call on our behalf, I'd be happy to.
Remember, I said I get it because being under the umbrella of Hilton Hotels, so they have a much bigger leverage.
We're a big state, right?
Yeah. So you should be able to get it.
I'll second the motion.
We have a motion and seconded. Everybody in favor, please say aye.
Aye.
Motion carries. Our next agenda item. Yeah.
Be number 6.
Oh. Yeah, sorry about this confusion. We had covered the other agenda item. Our next agenda item is 6A, is discussion of external audit report, State Auditor's Office, audit report of the distribution of National Research University Fund, NRUF. This item is reporting item only and does not require committee action. Mark Poe will present this item.
Thank you, Mr. Chairman. I'll be brief in my comments and certainly happy to respond to any questions that you may have. The State Auditor's Office released their final report in June on their audit of the National Research University Fund, and the State Auditor's Office was able to obtain reasonable assurance that the information that had been reported to the coordinating board by the institutions of higher education met the eligibility requirements, and therefore the funding was able to go forward to those institutions. The State Auditor's Office, they did work at Texas Tech University, the University of Houston, as well as here at the coordinating board. And the State Auditor's Office made recommendations at those institutions, as well as recommendations that were applicable here for our agency. The institutions that were audited, as well as our agency, agreed with the State Auditor's recommendations. The report's in your materials, and you can see that there's already action plans in place to address the items that were in the report of the State Auditor. Questions?
I'd like to know, are we going to, once you've got these action plans in place and you've begun to really ask for more criteria and you're getting more data and you're having them to really validate what they're using all of these funds for, are you going to give us a report back? I'd like to know really what our outcomes are based on what we've been doing and now what you're going to do forward.
Sure. Yes, ma'am. If I understand your question or your point, particularly as we talk about the compliance function and getting better in that arena or more focused, I think that would be a natural fit to be able to track these types of audit recommendations that are applicable to those institutions and make sure that they're being implemented and that our funds are being handled appropriately.
Well, and I'm kind of new to this, but I've been around a lot of researchers, and I know David has too. And there are times when dollars are spent where I've seen no reason or lots of questions around how dollars are spent. So I really appreciated the depth of this report, and I appreciate your action plans that you've already got on here too. So thank you.
Very good. Thank you.
how can we encourage other institutions to become part of this program? How can they get some funding, research funding?
They need to meet the criteria.
Yeah.
How can we encourage them? Is there a way we can encourage them? Can we do something?
I'm going to ask my colleague here from the program side to speak to your question.
They have to be classified in emerging research institutions, and there are specific criteria to become labeled an emerging research institution. So I know some of the criteria, but PNA is the division that is responsible for those classifications. Texas State University actually met the criteria this year, so they're officially part of the emerging research institutes.
So, can we do something from our Texas Higher Education Coordinating Board to encourage other institutions to be part of this program? Arturo, do you think we can?
David, maybe you or Susan can help me here. You walked in at the wrong time. Okay. What Dirk is asking is there anything that we can do to encourage the other 7, I believe it is, other 6, the NRUF institutions to be eligible for the NRUF distribution?
I think the fund encourages them to achieve the targets. I think that's the encouragement they need. I can assure you they're all trying to meet the metrics.
We cannot do anything in addition to what their institution is doing.
Well, hasn't the legislature established what it takes to be an emerging?
Yes, the legislature The legislature established metrics and asked the coordinating board to address additional metrics. We met with the institutions, established those. The board approved those, and they're working.
There's 7, Durga, and now with the addition of Texas State, there's a total of 8. So they have every incentive to move forward.
Some of the institutions were just much further away from the metrics to begin with, but we can already see the change in their behavior in terms of how they're addressing certain items on their campus based upon the incentives of the fund.
Right. Thank you.
Mr. Chairman, you had asked me when you and I first discussed this how much Texas Tech and U of H are receiving, which are the 2 that are eligible. And I have that for you. They are receiving right at $8 million. I believe it's 8.9, 7.9.
A little bit over 7.9, not quite $8 million.
Not quite $8 million, but almost.
Both of them are getting equal amount?
Yes, that's right.
Thank you.
Yeah. Thank you.
Mark, thank you very much. And next item, I guess you'll be reporting on that item also. The last agenda item under auditing is 6C, consideration and approval of risk-based audit work plan for fiscal year 2013. Mark.
Yes, sir. Did you prefer to take on item 6B first or 6C?
I didn't know that I missed 6B.
6B is the update on internal audit reports.
Yeah, please go and report on the internal audit reports.
Yes, sir. Thank you. Item 6B, update on internal audit reports. I'll try to keep my comments very brief given the late hour. This is a no action required briefing on internal audit activity. If you go back to the April committee meeting, at that time I had just begun in this position and I had identified a backlog of follow-up or projects that had previously been reported, but there had been no follow-up mechanism to ensure that management had taken action to address those findings or those recommendations. And so we identified 15 projects that we wanted to take a look at those recommendations. And so we're on track certainly to get all 15 of those projects looked at and reported on from a follow-up standpoint. Currently, we've reported on 10 of those projects. The 10 reports are in your materials, and I'm pleased to report that for all 10 projects thus far, plus 2 that are currently in the pipeline to be issued shortly, management has addressed all of those issues. So that's a very positive statement about the internal control environment and just the willingness to take corrective action based on audits. Just very briefly, the other aspect of this that I wanted to call to your attention is I'm attempting to categorize the reports for the benefit of executive management and for the benefit of the board. And so I've developed a system that I'll be using from here forward. And what we're going to do is categorize reports as either Category 3, Category 2, or Category 1. Category 3 reports are going to be the ones that hopefully are very few and far between, but those would be reports that have very significant issues, systemic problems that that are impacting the entire agency. The consequences could be financial or reputational, and we would certainly want to have a dialogue about any of those issues that are in a Category 3 report. Category 2 is kind of the middle ground. Those would be reports that contain conditions that we'll bring to your attention, but those would not be so severe or so systemic that the likelihood would be that we could just bring them to your attention. Management would address those on an individual basis, and we could move forward. Category 1 then would be those reports where it's clean. Hopefully, most of our reports are Category 1, and so with this briefing today, all of the 10 reports that were provided in your materials are considered Category 1 reports, and so I just wanted to bring to your attention that going forward, this is the methodology that I plan on using.
So Mark, this is intended to allow the board to focus on those that they need to focus on.
Absolutely.
Not that the other ones are not important, but
absolutely,
they just need less focus.
Correct, and all the reports will be provided to you, and certainly you can be briefed on any of them.
Thank you, Arturo. Thank you, Mark. I guess we can now move on to the last agenda item, 6C, that we have been waiting for. Consideration of approval of risk-based audit work plan for fiscal year 2013. Mark Poe will be presenting this item.
Thank you, Mr. Chairman. This is an action request seeking your approval. Agenda item 6C is the draft of the 2013 risk-based audit plan. Auditing standards and state law require that we go through a rigorous risk assessment process, and related to that, the outcome of that process then is a risk-based audit plan that gets approved and considered by the board. So what you have then in your package is 2 documents really, and I'll focus on one of them, and the other one is really primarily informational. You have the proposed plan, and I'll talk for just very briefly cover the audits that we're proposing to do in that proposed plan. You also have a document in there that's the computation of available audit hours. That's included for your information, but certainly we have to go through the process of calculating gross hours available for the 3 FTEs that we currently have in the audit function, and then we back out all of the administrative categories, training, other items to arrive at how many net hours do we really have that are available for auditing purposes, which in this case was a little over 2,000 hours that we have to work with. The risk assessment process that we go through, we have risk factors that we apply against all of the organization's major areas. We divide the organization into 9 major functional areas, and risk factors include such things as financial or reputational significance, the complexity of a particular operation or program, any prior internal or external audit results, how recently the area or how frequently that area would be reviewed by audit, and then also any significant change in mission or management of a given area. So we apply those risk factors to the 9 areas, and we visit with the board as well as executive management across the organization to get feedback, to discuss the ranking of risks. And so what we arrive at, we really put into then 2 buckets that you have on your on the document that's in your materials, the draft plan. We have audits that are really required either by law or by standard. And so the audits that you have before you that are the required audits that we account for first, there's a state law regarding an annual assessment of the organization's information security program, and that requirement is that the assessment be done by some part of the organization that is outside of the IT realm, and so typically that responsibility falls on the internal audit shop. So we have an audit dedicated towards information security. Our auditing standards require an assessment of organizational ethics and or the program for organizational ethics. We would work with the organization's ethics officer. This typically involves a survey of employees as far as awareness of what our policies and procedures are for ethics. It also takes a look at such matters as training of employees as it relates to ethics, policies, and procedures. So that's the number 2 required audit that we're backing out of available hours. And then the third area is just a general area, and that is investigations. As I'm sure you're aware, we have complaints that come from a number of sources, ones that come directly to the audit function, as well as ones that come to organizations like the State Auditor's Office that then hands those complaints to our office, and we work collaboratively with the State Auditor's Office to investigate those matters and to come back and report on the results. So those 3 areas are sort of carved out of the hours, and you see that listed under required audits in the plan, which then brings us to the last area. That's the other risk-based audits. For those, we really wanted to vet those very carefully. There's a couple things that we're trying to consider here. We want to make sure that our projects, to the extent possible, are really focused on the needs of stakeholders, focused towards the closing the gaps initiatives of this organization. In this case, focused towards addressing Sunset Issue 5. And so you might have the question, if you look at how the hours are laid out before you, there's a significant number of hours that are in the plan that are dedicated towards outward-facing audits, that is, audits of institutions of higher education. If you look at the formula funding audits that we're proposing and the student financial aid compliance audits that we're proposing, that would seem to go against what the Sunset Commission is recommending. What I would say is that if you compare this plan to the plan that we'll be putting together a year from now, you should see a dramatic decrease in outward-focused audits. But what we wanted to do this year is we wanted, as we develop the compliance function, we need a training ground. We need to be able to work with our new compliance staff, put them in the environment of performing work at these institutions of higher education, make sure that we develop a very high-quality, good approach to compliance. And so you'll see a migration or sort of a handoff of the work that's previously or currently performed by audit, and that'll start to migrate over towards the new compliance positions that we discussed earlier. And so that's why you see that level of resources dedicated towards those particular activities. There's a project in there for Sunset implementation assessment. I've received feedback from some stakeholders that because of the visibility of the Sunset process, that sort of a checkup or a report card, even though the Sunset process will go well through the next fiscal year, can audit come in and actually do just a snapshot assessment perhaps late in the fiscal year just to see where we're at with respect to each of the Sunset's recommendations. And so that information from that project would be brought here to the board. And then the last project that we're proposing is, again, related to an area that's very visible, and that is the accountability measures of this organization. There are key measures, as they're termed, and some of the key measures not only are known internally, but those key measures are highly publicized through the Higher Education Almanac, other activities that are very visible for this organization. And so this project for accountability measures proposes to take a close look at those key measures and actually tracing the source of those measures, the data that feeds them, back to the institutions of higher education, and taking a look at the quality of the data that is being reported to us and then very publicly used as a key measure. And that is a quick walkthrough of the proposed plan. I'm asking for your consideration and approval, and be happy to respond to any questions.
Any questions?
Move to approve.
I have a question. Can I ask a question? I was wondering, how do you select the for audit complaints, newspapers, or size of the institution? How do you decide who to audit, or everybody's audited?
Are you? I'm sorry for the
How do you decide which institutions to audit?
Yes, sir. The institutions, we actually perform a separate risk assessment. And so we look at the magnitude of the dollars that are flowing to those institutions. We look at such things as turnover in key positions, like, for example, the Director of Student Financial Aid position. If that position changes, then we would consider that institution to be more risky. We look at complaints that might come to us that would relate to that institution. So it's really a subset risk assessment or an additional risk assessment that is focused outwardly, that takes several risk factors as it relates to institutions of higher education, and we come up with a risk rank list of those institutions, and then we will be selecting those off of that list.
Right. Thank you.
So it's, I guess, fair to say that it's a rigorous process. It's not random or...
Absolutely.
Right.
Yes.
Not a random process.
It's not a random process, right?
No, correct.
I guess we have a motion. Second. All in favor, please say aye.
Aye.
Motion carries. And this concludes the Committee on Agency Operations meeting. Thank you all, and may I have a motion to adjourn, please? All in favor, please say aye. Adjourn. Meeting adjourned. No, we are going to go for dinner.